anemia based on hemoglobin concentrations in individuals are not recommended due to insufficient evidence. What I just mentioned is summarized in this chart, this table, and these are the cutoff points, the new cutoff points to define anemia. Here we have the cutoff point for anemia or no anemia, or then mild, moderate, and severe anemia. I don't know if you can see the cursor. Yes, go ahead. And the other thing that I would like to highlight, basically, that the separation of age groups in children and women that are pregnant or not pregnant, for pregnancy only resulted in a change for this group, which is children from 6 to 23 months, that was 110 grams per liter, and now it is 105, with a definition of severe, moderate, and mild. And another cutoff point that already existed, which is for the second trimester of pregnancy, which is also less than what usually used when you talk about pregnancy, less than 110. In this case, during the second trimester, is from 105 grams per liter. Then there is a group of recommendations related to the adjustments to the hemoglobin concentration that due to factors that are known to affect the concentration of hemoglobin. One of them is the elevation of place of residence. The recommendation is the adjustments in the concentration of hemoglobin for diagnosis of anemia, considering the effect of elevation of the place of residence on the concentration of hemoglobin. The most important changes in the table that you have on the right side are that the adjustment starts at 500 meters compared to the previous 1,000 meters. And the other adjustment are relatively higher for those residing below 3,000 meters of altitude, which is 98% of the population. And then the relatively minor adjustments for those residing at an altitude greater than 3,500 meters. And this is for some countries, it's not that relevant because they don't have those altitudes, but Peru, for example, and Bolivia have altitude, and this adjustment is therefore important. And here, this is a table by meters of elevation, but also the guidelines provide the formula that can be used in countries decide to use or not for each one of the values of individual hemoglobin. The other recommendation is about the adjustments of the concentration of hemoglobin to consider the effect of smoking. The recommendation is that the hemoglobin value should be adjusted to consider the effect of smoking on hemoglobin concentrations. These are slight changes. They change as opposed to the elevation changes that may make a difference in terms of the prevalence of anemia. Those adjustments for smoking are less marked compared to the previous recommendations. The basic change is the previous tables refer to packs per day, which in many countries correspond to 20 cigarettes, but not necessarily has to be that way. And to make things clearer, now they express in less than 10, between 10 and 20 cigarettes and more than 20 cigarettes per day. We provide the formula that has been used, so countries, if they decide to use it, or they just use the adjustment according to the number of cigarettes per day. Two additional recommendations considering the adjustments to hemoglobin concentration are about the effect of infection and inflammation, and about the effect of genetic, ethnic, or racial ancestry. The hemoglobin concentration should not be adjusted for a diagnosis of anemia to consider the effect of infection and inflammation. Because of the complex relationship between the concentration of hemoglobin, the changes in the body due to infection or inflammation, depending on the origin of infection, it's not that they don't exist, but it is not possible to establish a point of adjustment for the effect of infection as inflammation. With regards to the effect of race, the hemoglobin concentration should not be adjusted considering the effect of genetic ancestry due to the lack of evidence. And here it's important to highlight that there are documents from WHO that repeatedly mention studies of some years ago that show a clear difference between white race and black race of approximately 10 grams per liter, which in the course of years, there have been other papers showing a clear response in this regard. Therefore, the recommendations should not be adjusted. But because of the current evidence makes it very difficult to establish a clear adjustment factor. And on the other hand, something that is quite delicate is that the race, as well as the number of cigarettes, is something that's self-defined. I define as white, I define as black, blue, or yellow. That part make a difference in order to establish an adjustment in terms of race. And for that reason, this moment, the recommendation is not to make any adjustment in this regard. The other recommendation that has brought a lot of questions and interest and may occasion a significant change in the way, not only for the anemia estimation and how to measure hemoglobin, is the recommendation of the use of venous blood automated hematology analysis and high-quality control measures to evaluate the hemoglobin concentration in individuals and population. In individuals, is done with set frequency, and we talk about the difference for in the case of surveys or country evaluations. There's a clear variation in hemoglobin concentrations assessed from capillary and venous blood samples. However, the magnitude of the variation has not been confirmed. Therefore, it is not possible to provide adjustments to the hemoglobin measured in capillary blood to make it comparable to venous blood. Indeed, most of the samples that are used in most of the world come from capillary blood. WHO is making a great effort to establish if it is possible to have an idea of the magnitude of this variation. If that is the case, we'll have to make the necessary corrections in order to make any conversion or find any difference between the real value, the venous one, and what is reported in capillary blood. Once again, countries like Peru, where there are surveys, nationwide and regional surveys, most of them, I understand, are made on capillary blood samples, and that it's a factor to take into consideration. But it is important to carefully consider the blood source and type of analyzer and the comparison between different settings. I compared the survey of this year compared to the survey of 2 years ago, and I need to consider if the conditions are comparable and similar. When the use of an automated hematology analyzer is not possible, the use of an approved portable blood testing device that has been verified to be calibrated to international reference standards may be considered. This may be affected by temperature and other factors. It is important to be sure that the equipment may perform, because we understand that not everybody can have an automatic hematology analyzer. And also the use of good quality control measures at all points to the process, pre-analytical, analytical, and post-analytical. Consider if the individual is fasting, if it's sitting down, if it's standing up, and then also how we make the calculations and comparisons with other type of analysis. The other recommendation is about the impact of interventions, and it's recommended the use of hemoglobin concentration should be used as one of the markers to assess the impact of iron-related interventions. I'm going to repeat again, is the multifactorial origin of anemia. Most of the anemia may be due to iron deficiency, that is true, but there are other factors that are also important to consider as a cause of anemia. And when we have the global vision of all the causes of anemia, it's going to be very helpful to understand the prevalence or the changes in prevalence when we do an intervention. In any case, hemoglobin is one of the markers that has to be used in these cases. Finally, as part of the recommendations, The last recommendation of this group is the importance of anemia as a public health issue. The current recommendation is to maintain this significance because, as I mentioned, we try to find clinical or demographic results that may establish the cutoff point. Say, when a country has an income or level of education, any of these demographic results, then the anemia may be severe or moderate. There's not enough evidence to make those changes, and this classification, based on the expert opinion and has been used since the year 2000, should be maintained until we have new evidence. I remind you that this classification is severe anemia when 40% of the population is affected by anemia, moderate between 20 and 40, and mild when the prevalence is between 5 and 20%. I would like to finish before mentioning that this project of the hemoglobin cutoff points, despite of being older than this framework of action to accelerate anemia reduction, this project of cutoff point of this new guideline is going to help in this framework of action because this has 5 areas which will analyze the data on causes and risk factors. Well, these guidelines will fit perfectly, but also about prioritizing preventing and therapeutic interventions, optimize service delivery across multi-platforms, strengthening leadership, coordination, and governance, and expanding research, learning, and innovation to fill all those knowledge gaps that we still have. The expected results are to improve micronutrient status, reducing infection, inflammation, and chronic diseases, reducing gynecological and obstetrical conditions, and to improve screening and control of genetic disorders of erythrocytes. And here I would like to highlight once again the causes of anemia beyond iron deficiency, beyond folate or B12 deficiency. Here we are talking about what is the role of inflammation, what happens in areas where there's malaria, what happens when we have chronic inflammation, such in the case of obesity, how the hemoglobin is affected in this case, and how can manage our anemia data, reduce gynecological and obstetrical conditions, because we know one of the important causes of anemia in women in reproductive age and pregnant women, and the part of genetic disorders of erythrocytes, which is another of the conditions that I previously mentioned. We cannot talk about changes by race or ethnicity because this is self-referred. However, the genetic studies are important, although very expensive, and cannot be part of our recommendation because we will force countries in issues of deciding if they can carry out this type of studies, genetic studies. Among the actions will go beyond to what we know, go beyond health and nutrition. Dr. Kaye mentioned some of them. Go beyond fund and supplementation, treatment of infectious diseases. Also to include these ministries and organizations who we just usually don't include in our meetings, that has to do with agriculture, education, culture ministries, that everything that has to do, but it's not the first response from the nutritional point of view. There are many reasons, not only to produce, but to act upon anemia, and that makes us that going only with programs that supplement iron and don't consider other possible effects, we're going to have a limited success. And with this, I would like to conclude with my acknowledgments, specifically for the project of the cutoff points of anemia that started years ago, to some agency that not only offer financial support, but also technical support, such as the U.S. Agency for International Development, the U.S. Center for Disease Control and Prevention in the U.S., and the Walter and Elisa Hall Medical Research Institute in Australia will be in charge of all the project to establish the cutoff hemoglobin cutoff points in healthy populations. Thank you very much for your attention. Thank you very much, Dr. Garcia Casals, for your brilliant presentation. you have shown us the new guidelines from WHO about the cutoff point for hemoglobin after making a profound analysis of the evidence, and you have left us with some recommendations that we're going to briefly summarize. You mentioned about the hemoglobin cutoff points with a new group in children that goes from 6 to 23 months and a change in the second trimester of pregnancy. You also related to the adjustments of concentration, consider the elevation when the place of residence. We start at 500 meters. It used to be 1,000 meters above sea level, and the major adjustments in those below 3,000 meters, and the more greater adjustments those over 3,500 meters. You also mentioned the adjustments for smoking that considers number of cigarettes, not packages, and about the effect of infection, inflammation, or genetic ancestry have reaffirmed that there's no adjustments. And also with regards to the use of venous blood, the use of automatic analyzers, high quality methods, there's still not clear data with regards of making a difference between capillary and venous blood. You also mentioned that the hemoglobin concentration is not the only thing that has to be used for the evaluate the impact of interventions in this public health problem. And let's not forget that this is maintained with regards to importance of this problem in public health, regards to the classification, and it's more than 5 to 19 levels, moderate to level, and severe more than 40%.
Ok, gracias. También nos ha mencionado
It also mentioned with regards to an action framework to reduce the presence of anemia with 5 areas of actions with regards to analyzing data about the causes and risk factors, prioritizing preventive interventions and therapeutic interventions, optimizing health delivery in those sectors. And it is important to reinforce leadership, coordination, and governance at all levels, insisting with research, innovation in this area. And also, you talk about 4 expected results, such as to improve the micronutrient status, reduce infection, inflammation, chronic diseases, reducing gynecological and obstetrical conditions, and to improve screening and control of genetic disorders of the erythrocytes, as well as she mentioned that the actions should go beyond health sector, considering this a multicultural issue that's complex. We need to involve other sectors such as agriculture, education, housing, labor, social protection, and obviously health. Dr. Casal, once again, thank you so much, and please remain in the room for the questions that we are getting. And I will also like to tell you we have received many congratulations for your presentation. Thank you very much. Thank you. Then we give the warmest welcome to Dr. Nelly Zabaleta. She's graduated as physician at the National University of Trujillo. She has a master in nutrition from the University of Uppsala, Sweden. More than 30 years of professional experience in research and interventions in maternal and child health and nutrition. She has been the general director of the National Center for Food and Nutrition of the National Institute of Health in Peru. She is a member of the Advisory Committee on Nutrition of the Ministry of Health from 2014 to date, member of the Peruvian Society of Nutrition, president in the period of 2005-2007, and also member of the American Society of Nutrition. She has done several consultancies for WHO, PAHO, FAO, UNICEF, Inter-American Bank. These areas of research are nutritional anemias, micronutrient deficiencies, early nutrition, maternal nutrition and its relationship with a life course and vulnerability to non-communicable diseases, public policies in health and nutrition, with more than 80 scientific publications. In this opportunity, she's going to talk about strengthening public policies for the control of nutritional anemias. Go ahead, Dr. Zabaleta, you have the floor.
Muchas gracias, doctora Malki.
Thank you very much, Dr. Malki, for my introduction. Greetings to all the participants on this webinar, especially to all the countries member of the Andean Health Organization Hipólito Unanue Agreement. I'm going to start sharing my screen.
¿Se ve? Por favor, ponlo en pantalla completa, presentación.
Okay. Bien.
Okay.
Perfecto, gracias.
En este momento voy a hablar sobre
At this moment, I'm going to talk about strengthening public policies for the control of nutritional anemias.
Vean que estoy enfocándome, digamos,
I'm
en un tipo de
focusing on a type of anemia, which are the nutritional anemias, which are the most prevalent, not only in the Andean countries, but also throughout the globe. I would like to highlight, firstly, the importance of nutrition in early childhood. With years, there's clear evidence that shows the importance of nutrition and health care in the early stages of life, and that are going to determine the health status and the quality of life throughout the life course. In the case of nutrition, it is known through many epidemiological studies, as well as basic science studies, that a poor nutrition may influence through adaptive mechanisms and may produce some phenotypic changes that are going to influence in our postnatal life and in the coming years. Among the problems of malnutrition in our country, the most prevalent, we have nutritional anemias as well as chronic malnutrition and then obesity and overweight. But in the early stages of life, all of them had a common origin and are related intimately. It is very important in the case of anemia because it has already been mentioned in this meeting that in the early years of life is the stage of highest velocity of growth and development, and the consequences of poor nutrition, in this case by anemia, are going to affect the performance in different aspects of development. Here we see and we know that every second during the first 3 years of life, the neuronal connections are established, around 700 connections per second. In this stage of high vulnerability, a poor nutrition such as anemia or any other condition such as disease or abuse may have serious consequences in the human potential and the comprehensive development of our existence, because this is the fundamental pillars of health. And also to highlight that during pregnancy and during the first years of life, the first year in particular, there is an accelerated growth. And in this accelerated growth and development, is that nutritional needs are higher compared to any other stage of life. In particular, in the case of iron, the needs are elevated during pregnancy and in the first year of life. And it's also important because in the third trimester of pregnancy, it is the fetus who's going to accumulate the iron stores that are going to protect them in the first months of postnatal life. Therefore, a premature baby or low birth weight child is going to have a higher vulnerability of presenting anemia. There are also other interventions that have shown that we can protect the infant in the first month of life,
se realizan intervenciones
if we
como
carry
el
out
paquete
interventions
seguro
such
del
as the
cordón
late
umbilical
clamping
que le va a
of
permitir
the
que
umbilical cord that can allow them to
naciendo
have an additional
pueda
reserve
sostener
of
al
iron
niño
that's going to
que
protect
será
them from
hasta los
anemia
6 meses de vida.
that present before the 6 months of
Vemos
age.
pues que en el
We
primer año
see
de vida
that in the
un
first
niño que
year of
nace
life,
con 3
a
kilos
child who's
más o
born with
menos
3
alcanza
kilograms
alrededor de 10 kilos
has
al
10
término del
kilograms
primer año de vida y
at
esta
the
elevada
12 months
velocidad
of
de
age,
crecimiento
and this
va a
elevated
significar una gran,
growth speed implies
gran necesidad de
a
múltiples
great need
micronutrientes.
of
Acá vemos el
several
ejemplo,
micronutrients.
es
In
el
this
caso del
chart,
hierro.
we see iron,
El niño al nacer trae
that
una
the child, when
hemoglobina
is born, it
alta
brings a
que le
high
permite tener una
hemoglobin
reserva de
that allows them to
carbohidratos
have an iron
suficiente
store
en los
that's going to
primeros
be
4 meses
recycled
de vida,
in the first months
pero
of life.
a partir de los 4 a
But
6 meses
start
de edad,
from
el
4 to 6
niño
months of
necesita una
age,
fuente
the child
adicional de
needs an
hierro.
additional
Y esto
source
es
of iron,
cuando las
and it is
carencias de este
precisely
nutriente
the
y de
lack of
otros
this nutrient
micronutrientes
and other
en la dieta que pone al
micronutrients
niño
in the
muy
diet
vulnerable
make the child
en esta
highly
etapa de la
vulnerable
vida.
in this stage of life.
Para destacar también lo
To
importante de la
highlight the
anemia es el
importance of
enfoque
anemia
preventivo.
is the
Debe
preventive
asegurar que
approach.
el niño tenga
Make sure
una
that the child
alimentación
has
saludable,
a healthy
adecuada,
nutrition
que le
that's
permita
adequate,
cubrir
that
todas
allows
sus
them to
necesidades
cover
nutricionales,
all their
que
nutritional
cuenta
needs,
con una atención
and
de
that
salud
has
que le
a
permita
health care
prevenir,
that
ofrecer una
allows them
atención
to
oportuna
prevent or
de
receive
salud y una
timely
adecuada
intervention
estimulación
in
de
health and also
porque de
adequate
tal manera el
stimulation
niño va a
so
prevenir
that the
no
child is
solamente
going
la
to prevent
malnutrición,
not
sino que va a
only
alcanzar
malnutrition,
un
but is going
desarrollo
to reach
adecuado y va a
an
poder
adequate
lograr
development
alcanzar
and is
también su
going to be able
potencial.
to
Por lo
reach
tanto,
its
el
full
enfoque
potential.
preventivo
Therefore, the
siempre será
preventive approach is
el
always
más
going to be
recomendado,
the
pero también
preferred
es
one,
importante
but also it
hacer un
is
diagnóstico
important to
adecuado
make an
y dar un
adequate
tratamiento
diagnosis
oportuno
and provide
en
a
algunos problemas nutricionales como
adequate
por
treatment
ejemplo
for some
el
nutritional
autismo.
issues such as anemia.
Cuando hablamos del manejo de la anemia tradicionalmente,
When we talk
hemos
about
estado enfocados
anemia management, we
en,
traditionally were
esta
focused
área, en las
on
anemias
this
por
area
deficiencia de
of an
hierro
iron
tradicional,
deficiency anemia
la suplementación con gotas de
when
hierro.
we provide
Sin embargo,
supplementation with
debemos
iron
saber
drops.
que la anemia
However,
puede
we know
tener también
that
otras
anemia
causas
may have
que
other
ameritan una
causes that
correcta evaluación
deserve
y
an
un adecuado
adequate
tratamiento.
evaluation and adequate treatment.
Pero aproximadamente
But
las diferentes
approximately, the
investigaciones
different
muestran
researchers
que
have shown
alrededor
us
de un 50
that
a
around
60
50 or
6% de las
60%
anemias
of
nutricionales
nutritional
tienen
anemias,
evidencia de déficit de
there's
hierro.
evidence of
Este fue un
iron
estudio
deficiency.
que
This is
realizamos
a
en la
study
selva
that we did in the
amazónica de
jungle, in
Perú
the
y
Amazon
vimos
jungle in Peru,
que ese era el
where
caso.
we see that that was the case.
Ya la doctora Casal
And
explicó,
Dr.
digamos,
Casal has
cómo el
already
año pasado
explained
la
how
Organización
last
Mundial de la
year
Salud
the World
sacó
Health
una
Organization
recomendación
issued
de cómo
publication
acelerar la reducción
of
de
how to
anemia,
accelerate the
dado
reduction
que
of
hoy en
anemia,
día la anemia es un indicador
because
que no
nowadays anemia
diagnósticamente
is an
robusto
indicator that not only
y que
measures the changes in
probablemente
hemoglobin, but is really
benefició a
measuring
los servicios de
the
salud
quality of the health
y el
services
nivel de vida
and the
de la
level of life
población.
of a
Por lo tanto,
population.
es un indicador
So
realmente
it is a
muy complejo
very complex
y muy útil
indicator
para medir
and very
nuestro
useful
estado de
to
salud y
measure
nutrición.
our
Y en este
health
marco conceptual de la
and
anemia,
nutrition status. And this
cómo optimizar la
conceptual
biosíntesis de
framework,
hemoglobina
how
para
to
evitar la
use
dispersión de
hemoglobin
microcíticos y
to
las pérdidas de
improve
hierro,
the
básicamente tiene que
optimize
ofrecer
hemoglobin
resultados
synthesis and prevent
puntuales y
destruction
tiene que
of erythrocytes
verificar
and
estos
blood loss.
resultados
It has to
con
do
la
with those
mejora de
two
los estados de
outcomes
salud
with
y
improving the
además
health
tiene que verificar
condition
con la
or status,
mejora
and
de
also
la
has to do
alimentación
with
para
improving
mejorar no
feeding
solamente
and nutrition
el
by
nivel
not
de
only
hierro en la
improving the
alimentación,
level of
sino
iron
también al
in
mejorar los
food,
otros
but also by
macronutrientes,
improving
vitaminas,
the
minerales y
other
también la función
micronutrients such as
celular.
vitamins and minerals,
Y en el
and
caso de
also
las
protein.
infecciones,
And in
para
the case
reducir
of
la carga de
infections,
enfermedad
to reduce
tanto
the disease
infecciosas como
burden,
inflamatorias,
both infectious and
crónicas. Y
chronic
prolongar
inflammatory,
durante el periodo
and
del
on the
ciclo
side
reproductivo
of the
para
reproductive
reducir el
cycle
riesgo
by
tanto de
reducing
la mujer en edad
the
fértil
risk
de que
of
durante la gestación pueda presentar algún
women that
problema de
when
sangrado y
have
también
anemia during
por no
pregnancy because of
recibir una
excessive
buena
bleeding and
alimentación
by not receiving
adecuada que la
adequate
proporcione la
nutrition
mamá
that
durante
protects them
la
from
gestación
anemia
y afectará
during
también
pregnancy.
al feto.
That is also going to affect the fetus.
En esta lámina tenemos la
In this slide, we
comparación
have the
de cuáles son
comparison
las
of what
recomendaciones
are the
de la ingesta de hierro en los
recommendations of iron
primeros 3
intake
años de
in
vida
the
en el
first 3 years of
primer
age
año de vida
We see that in the first year, according to WHO, we should have this intake of iron of 18 milligrams. But actually, in the case of Peru, we're showing data from Peru of iron consumption from the Nutrition Institute of Peru. There's a large gap between what is being consumed and what are recommendations. And this gap is reduced in the second year of life and much more during the third year of life. But it's really showing that part of this anemia is also expressed by iron deficiency in the diet. But it's not only iron what is producing the anemia, but also here we see table as chart in the study in the highlands of Peru in Ayacucho, which shows the percentage of children who do not cover their energy and vitamin and mineral recommendations. We see that it's not only iron, a deficiency in iron, but also B complex vitamins, minerals such as zinc, vitamin A, among others. So it is very important to have a comprehensive management with a healthy diet for the child and for all the life course. And the vitamins have an essential role in erythropoiesis and are going to contribute to reduce anemia or to prevent the anemia. So it is very important to highlight the comprehensive management in improving nutrition, going beyond iron, considering the other macro and micronutrients. And as Dr. Casals mentioned, that we have new cutoff points for the diagnosis of anemia, and the changes are made, especially in children between 6 and 23 months of age, for women in their second trimester of pregnancy, and for populations who live in highlands. And all these recommendations are evidence-based. These are the new cutoff points, but we know 110 grams is now 105 grams per liter, which is a difference of 0.5 grams per deciliter. And it's also a similar decrease in the case of pregnancy, and also the adjustment factors by altitude. Here, what I would like to show you that in the case of Peru, for the last 20 years, even more, has been evaluating in a constant way the health and nutrition status of the population, and this is the case of hemoglobin in children 6 to 36 months of age. And we see how in the year 2000, the prevalence of anemia children at the age of 3 was of 60%. That has gradually reducing, but for the last 12 years, the levels of anemia remain constant, despite that Peru has a commitment in actions for the reduction of anemia. So it's also important to have this present, because to what extent these figures are going to change. And here we see that precisely in those national surveys that the most elevated prevalences occur in children between 6 to 18 months of age, that we see here in the orange bars. And this is precisely the age where we have new cutoff point values for the evaluation of anemia. But to show what would that potentially imply, this is an exercise made by the Senan Center in the our National Institute of Health, of how in the register of the health and nutrition status of the population that goes to health services in children under the age of 5 from the different regions of the country, how this anemia prevalence will have some variations both in the national average as well as the level of each region. There are some regions, most of them, quote unquote, will be decreasing those prevalences to some degree, and the very few will be increasing the prevalence. What shows that the map of prevalence of anemia is also going to have other regional characteristics. Traditionally, in the case of Peru, in the Andean areas, especially in the south part of the country, had higher prevalences, but because we have adjusting by age and altitude, now we will have the areas of the jungle having a higher prevalence of anemia. This has important implications because it will talk that we need to have a comprehensive approach, but also an adequate approach to the height or the weight of the factors that produce anemia in each one of these regions. For some regions, undoubtedly, it's still a very concerning problem because we have very high prevalence in small children. And this is another exercise that doctors from the University Cayetano Heredia have analyzed and compare the national surveys from ENDES in recent years from 2001 to 2024, and we see how would be the trends by using this new cutoff point from WHO and what has been before with the traditional cutoff point. What we see is that the magnitude of anemia is maintained. There's similarities, but there exists a difference between both prevalence that's going to require later on when Peru is adequate to the new WHO recommendations to analyze them in more detail, investigating not only at the national level, but also at regional level. These changes in prevalence between boys and girls between 6 and 23 months are going to have some variations in our country, especially with some regional characteristics. Also changes in the high altitude locations, changes in the prevalence between the regions of the jungle and the highlands. And we also have to highlight that the adequation to these new measurements is going to imply a need of training in human resources, in diagnostic methods, in prevention and the management of nutritional anemias. And they also require to continue investigating not only for the hemoglobin diagnosis using these automatized and calibrated equipment, but also investigating with other nutritional biomarkers and also of inflammatory status. It is also precisely to continue working and evaluating and about interventions to see the efficacy in women of childbearing age, pregnant women, infants under 6 months, because in that group we still don't have much information and the importance in the weight that it has, the factors that lead to anemia in some geographical regions where the prevalence is much elevated. In the diagnosis of causality and control of anemia, it is also important to have a standardization of measurement techniques with the health personnel, assuring the good precision and accuracy of measurements. It's also important to make sure about the maintenance and calibration of the equipment on a regular basis to ensure permanent monitoring and evaluation. It is necessary to study some causality factors in the most affected regions and prioritizing vulnerable populations, not only by age groups, but also by geographical area and higher vulnerability, since we have regions that have a high nutritional insecurity. Very important to see the impact and efficacy of interventions is to sensitize the population on the importance of nutrition on the national development. And also very important to continue investigating and publish this new evidence and publish them on a timely basis. And very quickly to summarize the strategies for prevention and control of anemia that Dr. Casal already mentioned: supplementation, fortification, improvement of home and community conditions, public health interventions, all show that we need to work at the nation level with multi-sectorial plans with intergovernmental plans that are coordinated, and that this way we can have the optimism that in the coming years anemia will be a nutritional problem can be under control with the participation of all government, academia, private sector, and civil society. We trust that we can make a significant reduction of anemia, and it's important to highlight that these public policies have to be based on evidence when we need to prioritize vulnerable groups, such as the population of 1,000 days, the first infancy, and also prioritize preventive actions, monitoring and permanent evaluation, and corrective actions when necessary. Thank you very much for your attention, and I'm ready for any questions. Thank you.
Muchas gracias, querida Nelly.
Thank you very
Muchísimas
much,
gracias
dear
por tu excelente
Nelly.
presentación. Nos
Thank
has
you for your
enfatizado
excellent presentation. You
la
have
importancia
emphasized the
de
importance
la nutrición en la primera
of
infancia,
nutrition in early
tener
infancy
impacto, efecto
that is going to
sobre
have
todo
an
el
impact and
desarrollo.
effect on all the life course.
Un dato tan importantísimo,
That's
que lo
something
que has dicho,
extremely
que
important,
cada
such
segundo
as the one that
hay
every
nuevas
second
conexiones
there's 700 new neural connections established
años, ¿no? Como para
in the
tener
first 3 years of life.
claro qué
So
capital es esta
see
etapa
what
de vida, ¿no?
important is
Y
that
obviamente, como están en la parte
stage
del
of life,
crecimiento, tienen
and
mayor
because they are in the
necesidad,
growth
mayor demanda, ¿no? De
portion with
hierro,
higher demands of iron,
y
micronutrients,
lo
and
más
others.
importante en la
And
anemia
that
y
the
sobre
most
todo
importance in
prevenir,
anemia is
no
to have the
prevenir,
preventive
porque lo
approach.
ideal, ¿no?
They shouldn't have anemia,
Eso
which
es
would be
para
the
evitar la
ideal in
malnutrición
order to
y
prevent
tener mejor
malnutrition
desarrollo
and have better
en los niños, ¿no? Y para eso
development in children. And
es
therefore,
necesario tener un
it
diagnóstico
is we
adecuado y
need an
un
adequate
tratamiento
diagnosis
oportuno para
and
evitar
a
todas las
timely,
consecuencias
adequate
que pueden
treatment
ser.
to
Si
avoid
bien la
all the
anemia
consequences.
es en
And
su
although
porcentaje,
anemia
estos
is
médicos dicen que es
mostly
de 50 a 60%
of
por
50 to
deficiencia,
60% is because
también
of
hay otras
iron
causas que no
deficiency,
debemos
there are
dejar
other
de
causes that we
atender,
should
¿no?
not
Abordarlas
forget,
y que debemos hacer
and that we should
el diagnóstico adecuado.
do the adequate diagnosis.
Y y controlar esto y acelerar la
And
disminución, pues
to
también no solo es
control and decrease
sino
is
que
not
también es
only to
necesario
measure how
estar
many
viendo, ¿no? Qué
anemia
calidad de
cases we have,
salud, qué nivel
we
de
also
salud
measure the quality
en
of
cada país.
health services and the quality in each country.
Hemos visto cómo nos has mostrado que
You
la
have shown
ingesta
us that the
está por debajo, también
intake
en el
is
caso de Perú, creo,
below,
por
in the
debajo
case
de
of
los
Peru,
requerimientos necesarios
below
según
the
su edad.
requirements
Es decir,
according to
son
their
niños
age.
requieren 18
6 from 11 months
ya
require 18,
de
and there's only
que
can
no todo es
consume
hierro, ¿no?
6 or so.
También
And not everything is iron.
vitamina B12,
Vitamin
nutrientes, es
B12,
decir, una
micronutrients.
dieta saludable.
That's a healthy diet we're
Y
talking
no
about.
solo en esta etapa, sino en todo
Not only in
el
this
curso de vida.
stage of life, but during the entire life course.
Entonces, definitivamente, bueno, también nos has mostrado
You
cómo va la
also
tendencia
shown
de
us
anemia en los menores
the
de
trend
6
of
a 35
anemia
meses en
in
Perú.
the 6 to
Va
36
bajando.
months age group in
Hubiéramos
Peru.
querido que sea más
It
rápido o
has been
mejor ese
decreasing,
dato,
but we
pero
would
bueno, es
like
el que
to have
tenemos.
better
Pero
data,
ya el
but that's what we
protocolo
have,
para la prevención y
and that
control de
Peru has
anemia
strategies to prevent and
se ha
control
ampliado
anemia.
y todo. Muchísimas gracias, querida
Thank you
Nelly.
very
La
much,
gente
dear Nelly.
están llegando preguntas
We have
y
questions
cuestiones.
for
Así
you,
que te
and
pedimos que nos
congratulations. And
acompañes
please
hasta
just wait
el
until
término
the Q&A session.
de las presentaciones para continuar con las preguntas. Muchísimas gracias,
Thank
nuevamente.
you very much once again.
Seguidamente
Now,
vamos
I would like to
presentar a
introduce
la Magíster María Elena Ugaz.
Master María
Ella es
Elena Ugaz.
oficial de
She
Desarrollo
is
Médico
Early
Central
Childhood Development and
de la
Nutrition
Organización de
Officer
las Naciones
of
Unidas
the
para la
United
Infancia,
Nations
UNICEF Perú.
Children's Fund, UNICEF Peru.
Especialista en políticas
She's a
públicas
specialist in
integrales en la
intersectoral early
infancia,
childhood
con
policies
más de 30 años
with
de
more than 30
experiencia en
years of
diseño,
experience in the design,
implementación
implementation,
y monitoreo de
and
políticas de
monitoring of
desarrollo
early childhood development
integral
and
y
nutrition
nutrición.
policies.
Asesora de intervenciones
He
para el
advises on
impacto
high-impact
que promueve y
interventions that
mejora
promote the
indicadores de
improvement of
salud,
health,
nutrición,
nutrition, early
desarrollo
learning,
temprano
and emotional development
emocional en
indicators
la población infantil
in the child
con enfoque
population
integral e
with a
incluyente
comprehensive and
para
inclusive
intenciones
approach,
vulnerables.
especially in vulnerable areas.
Impulsa las intervenciones
She
para
promotes
mejorar la
interventions to address
nutrición en
malnutrition
niños,
in
niñas y
children
adolescentes.
and
Ella
adolescents.
es nutricionista
She is a
con
nutritionist
posgrado en ciencias
with postgraduate
políticas y
studies in
gestión
political
pública,
science and public
salud
management,
humana y desarrollo
human nutrition,
sostenible
and
para
early
niños y
childhood
niñas.
development and
En
attachment.
esta oportunidad
In this
nos presentará
opportunity, she's going to
anemia
present
y malnutrición
anemia and
como
malnutrition,
abordaje
a
sistémico.
systemic approach.
Adelante,
Go ahead.
María Elena, por favor. Adelante.
Marilena, please, you have the floor.
El espacio.
Bueno, muchísimas gracias.
Well,
En primer
thank you
lugar,
very much.
agradecer a
First of all, I would like to thank the Horas Conjur for this kind
Bueno, tengo un
invitation.
reto enorme
And as I
después de
have a
las
major
dos
challenge
magistrales
following these two
presentaciones que
wonderful
han hecho la doctora
presentations
García Casal
made
y
by
Elisa
Dr. Garcia
Valeta,
Casal and
y
Elisa Valeta.
complementando, porque creo que
And
se
by
refuerza, voy
adding
a
and
compartir mi
complementing, I'm
presentación,
going
no
to
sé
share
cómo
my
se
presentation.
puede observar. Bien,
Lo pones, por favor, en pantalla completa, a ver.
pantalla
Sí.
completa. ¿Está en pantalla completa?
No, no se ve en pantalla completa.
A ver, dígame, por favor, por mirarlo
Making
un
some adjustments to
momentito.
my screen.
Eh, eh, Déjeme ver un ratito para ver. Sí. Voy a volver mejor a
Disculpa, María
proyectarlo.
Elena, creo que donde dice display settings, arriba, arriba al segundo.
Ah, ya, sí,
Si
tienes
le das
razón.
ahí, cambia
Ah, ya,
y quitas
acá,
la,
¿no?
creo,
Acá, sí.
el swap, ajá, a uno de los dos, exacto. Creo.
Ah, perfecto.
Ahí
Ahí
está.
está bien, está perfecto.
Ya, ahora sí se ve
Muy
bien.
bien.
Perfecto.
Bueno,
Gracias.
Okay,
muchísimas
go ahead.
gracias.
Thank you very much.
Voy a
It
hacer todo el
is, I'm
esfuerzo de
going to make the
complementar las
effort
magistrales
to
presentaciones que han hecho
add
y
some
abrir un poco el
contributions to the wonderful
panorama
presentations
que de
and to
alguna
open
manera se
the
estaba
scope
mencionando
that
anteriormente
has
en las
already been
presentaciones
mentioned
anteriores,
in the previous
que es el tema de la
presentations.
anemia y
It has
malnutrición
to
en
do
enfoque
anemia
sistémico.
and
Creo que esto
malnutrition as a
refuerza mucho.
systemic approach.
Y solamente mencionar algunos
Just to
aspectos
mention some
alrededor de la
aspects
situación global.
regarding the global
Tenemos
situation.
pues que realmente en el
We
mundo
have that
hemos sido
throughout the world,
exitosos en
we've
la
been
reducción
successful in
de la
reducing
desnutrición crónica
a
infantil.
chronic
Perú es
infant
uno de los países
malnutrition,
que
and Peru is
tiene
one of the
en
countries that
América
has
Latina
had,
en general.
in Latin
Podemos
America in
sacar
general, but as we can see,
el número de niños y niñas
the
menores de
number of
5 años del
boys and
2000
girls
al
under the age
2022
of 5 and
de
2000,
204
2022
millones de
of
niños y
204
niñas
million
a
children in 2000
148
to
millones en
148
2022.
million in
Vemos acá
2022.
una disminución
You see,
importante de
and
un tercio desde el
significant
año
decrease
2000
to by
de la
one third
prevalencia de
in
nutrición
since 2000
crónica
in the
o
prevalence of
carga de
chronic
nutrición
malnutrition.
crónica
Of the
en
chronic
países
malnutrition
desarrollados
burden,
de
we're
55
talking
millones de
of
niños.
55
Realmente
million
este es un
less
avance
than
muy
2000.
importante que ha
This is
tenido
a
el mundo
significant
y
progress made
América
throughout the world,
Latina es parte de
and
este
Latin
importante
America is
avance.
part
Y
of
como
this
vemos
important
acá,
progress.
y
And
esto
as
lo
we can
refiere
see,
desde el año
this is
1990.
in
Por tanto,
1990.
esto es algo que no se ha
So
visto.
this is something that is
Sí
not
podemos
shown,
lograr resultados
that we
importantes
can
en la
obtain significant
reducción
results
de los problemas
in
nutricionales. Esta es
reducing
una muestra que
nutritional
nos da
problems. This is
optimismo
a
para
sample
que podamos
that
comenzar
makes
con
us
una
optimistic,
mirada positiva de que sí
optimistic that we
vamos a
can
lograr
have a
también
positive look,
reducir los
that we'll
otros
also be
problemas
able to
nutricionales.
reduce the other
Sin
nutritional
embargo,
problems.
tenemos también nuevos
However,
retos
we
globales
have
en
new
nutrición
global
infantil.
challenges in
Así
child
como
nutrition.
mencionaba anteriormente,
As
se
I
ha
showed
bajado la
before,
desnutrición
we have
crónica, pero
decreased chronic
miremos ustedes
malnutrition,
cómo
but look
está la
at
prevalencia
the
de la
prevalence
desnutrición aguda, que está
of
aquí
acute
en color
malnutrition
rojo,
here
como ustedes
in
pueden
red,
ver, y la
as you can
prevalencia
see,
del
and the
sobrepeso y la
prevalence
obesidad
of
en
overweight and
niños
obesity
menores de 5
in
años.
children under
Y
the
como
age of
pueden
5.
ustedes ver acá,
As
estamos
you can
aquí en el
see,
año 2022.
in the year
Por primera vez,
2022,
el número de
for the
niños y
first
niñas
time, the
menores de
number
5
of
años
children,
con
of
sobrepeso y
boys and
obesidad
girls
está a
with
punto de
overweight and
superar
obese
el número
is
de
going
niños
to
con
be greater than the
obesidad.
number of
Y
children
esta es
with
una
acute
alerta
malnutrition.
importante
And this is
que
a
le están
significant
haciendo muchas
alert
organizaciones
that
también,
many
muy,
organizations
muy
are
de la mano con
issuing
la Organización Mundial de la Salud.
together
Esto
with
es algo que nos está
WHO. This
diciendo
is something
que
that's
tenemos
telling
que
us
mirar una manera
that we
más
need to
integral
look
el
a more
abordaje de la
comprehensive way
problemática
how
de la
we approach
nutrición. Y
the
aquí
child
algunos datos
nutrition.
solamente
And
como
here's some
resumen,
data
al menos uno de
summarizing
cada tres
at
niños
least
y
one of
niñas
every
tiene un
3 children
crecimiento
has a growth
subóptimo debido a la
subop
malnutrición.
So we're talking about growth because of malnutrition. We're talking about all types of malnutrition, and at least 1 in 2 children suffer from anemia and deficiency of essential nutrients. Not only is iron, there are other micronutrients involved, and also animal protein. And at least 2 of 3 children do not receive the minimum diet they need to grow and develop healthy. This gives us an alert because I'm going to talk about this third group of children. Just to mention, anemia is a persistent problem, it's a global challenge, it's also a challenge for the Andean community and for Latin America and the Caribbean. We're talking about 50% of the cases of anemia of mother and infant are nutritional in origin. And here, just to briefly mention the prevalence of anemia in pregnant women aged 15 to 49 years worldwide, 36.5%. We can see with a color map what are the most critical areas. And here we have children aged 6 to 59 months with 39.8%. And we can see that in our region, in Latin America, situations are of concern. And this is a child nutrition report from UNICEF about child food poverty. I'm going to explain this later on because we've seen very important reports that tell us that food security and how there is food insecurity that affects our population and also affects our childhood. But here they carry out an analysis about the diet diversity, what the child eats, what gets to the plate of the child, and that gives us a reading in terms of that situation that is affecting children. We know that in Peru, around more than 50% of families or population, she corrects herself, have food insecurity in Peru. But how much of that is having an impact in the nutrition of our children? How much of that is impacting the nutrition quality of our children? And that concept is refer more of a problem of food poverty. And here I would like to show you from this report that we have recently issued that 1 in 4 children in the world, that's 27%, that's 181 million, live in severe early childhood food poverty. In their early childhood, Dr. Nelly spoke about the importance of nutrition for the early childhood, and this is a very large proportion that we have. Here we have a red bar and an orange bar, and just to explain the severe child food poverty, when we find that the child consumes 2 or less food groups, the moderate childhood poverty, 3 to 4 food groups of the 8 food groups that you expect that had to be considered in nutrition diversity. And we see how Latin America and the Caribbean, that include the Andean countries, 9% and 28% for moderate. So we are talking of a problem that is of concern. Here, specifically for Latin America and the Caribbean, showing, as I mentioned before, but looking at the total, 181 million in the world, in total 440 million of children under the age of 5 are living with food poverty, and that is a situation of concern. It is true that the severe is much more concerning because it brings higher risk of not only acute malnutrition, but also anemia and other deficiencies, and therefore the risk of morbidity and mortality in the early childhood. And here I would like to show you how we're doing in Latin America. 5 million, 9% represent 5 million children that live with severe food poverty. And in Latin America, we're talking about 18 million. So this is something of concern. And here just to mention this duality. So if there's severe food poverty, we will expect that they don't have enough food, and that is true. But at the same time, we see a situation that in these children that have a severe food poverty, also consume unhealthy foods and sugar-based beverages. And here we're going to see, I'm going to show two examples. For example, Burkina Faso, of the children, 6% consume unhealthy foods and 10% of sweetened beverages. Let's look at Nepal. Nepal, 42% of the children who have food poverty consume unhealthy foods and 17% sweetened beverages. So we can see, and this is an analysis done for the 24-hour recall, we see this duality has made that UNICEF present the situation center in childhood. And I would like to show you a very short video that explains the situation and some actions with this systemic look. And that has been mentioned.
Today, I'm going to tell you about something children globally are suffering from severe child poverty. In short, it's when a child can't access and consume nutritious and diverse diet in early childhood, the most important time in a child's life. Children need to eat food from at least 5 to 8 nutrients for healthy growth and health. Your child's poverty is defined when children get too food. UNICEF tells us that in some countries, this will mean that a little bit of rice, milk, the world can help child food poverty. Firstly, I'm going to tell you about something outrageous. 1 in 4 children globally are suffering from severe child poverty. But what is it? Reach parents and instead make in 3 key ways. Firstly, we need to stop overflowing shopping unhealthy foods and instead make nutritious and healthy foods the most accessible and affordable option for parents of young children. Secondly, teach parents and advice on what and how to feed their young children. Thirdly, we need to support the poorest and most vulnerable parents with cash benefits, vouchers, or food so that they too are able to feed nutritious foods to their young children. Want to learn more? Check out UNICEF's new Child Poverty Report.
Quisiera solamente, gracias
Just,
por,
thank you.
disculpen que esté en inglés,
I
pero
apologize for
solamente
this
mencionar estas
video in English, but I would
tres
just like to mention
especificaciones.
these 3
Disminuir la
strategies
oferta de
to
alimentos
decrease the excessive
processados
supply
en
of
niños
unhealthy foods and sugary beverages.
Nosotros vemos,
And we
lo
see,
hemos visto en Perú
and
también,
we've seen in
en
Peru
zonas rurales, en
that in
zonas
rural
donde son
areas,
indígenas,
areas
existe una gran
indigenous
oferta
areas,
de
there's a
estos alimentos.
great supply
E
of these
incrementar la
foods,
disponibilidad de
and to
alimentos
increase the
nutritivos.
availability
La
of
segunda
nutritious
medida,
foods.
incrementar la
The second
inversión
strategy is
en
to increase
servicios de
investment
nutrición para
in nutrition
brindar
services
a
to
los padres
provide
más
parents with
información
more
y
information
educación para
and
mejorar la
education to
nutrición con
improve
la práctica
nutrition
de cambio de
with
conducta.
behavior change
Incrementar
strategies.
la inversión,
And to
porque ese
so
es
it
el
has
tema.
increased investment because that's
Sabemos que
the
es muy
issue.
importante,
We know
pero
that this is
necesitamos
very
más
important,
inversión para
but
que
we need
nuestras
more
niñas y
investment
niños.
so
Y
we can do this.
finalmente, tenemos población
And finally,
vulnerable,
we have vulnerable
migrantes,
child
que es extrema
population,
mayoría.
migrants, extreme
Y
poverty, and
ahí
others.
tenemos que
Here
compensar
we
tanto
have
con
to,
medidas de protección social,
with
vales,
protection
bonos para
measures
comprar
such as
alimentos
vouchers or
nutritivos, alimentos
to purchase
fortificados
food,
y
fortified
otros.
baby foods, and others.
Perdón. Ahora quisiera darle un
Now I would
panorama
like
a
to
los
show
colegas
you
en América Latina
what we
alrededor
see
de
in Latin
malnutrición muy
America as
rápidamente,
regards
¿no?
malnutrition.
Y
This is
tenemos
very
pues
quickly.
la doble carga
We
de la
have this double
malnutrición. Si
burden of
sumamos la
malnutrition.
deficiencia
If we
de
add
micronutrientes,
deficiency of
hablamos de la triple
micronutrients, we
carga de
talk about the
malnutrición.
triple
Y como
burden
podemos
of
observar
malnutrition.
acá,
As we can see,
Ecuador, por ejemplo,
Ecuador,
27 desnutrición
27
crónica
malnutrition,
y
chronic
15
malnutrition,
pues sobrepeso
and
y
has
obesidad en menores de
overweight and
5 años,
obesity in less than 5 years,
11,9, Perú
11.9.
10,9%,
Peru, 10,
Bolivia
9%.
también,
Bolivia,
tenemos Chile,
we have
¿no?
Chile,
Tenemos
we
Argentina,
have
Uruguay,
Argentina,
¿no? Entonces
Uruguay.
tenemos también que estamos
So
viviendo
we
este
are
momento
living
de
a
dualidad
moment
que
of
tenemos alrededor de los
duality
problemas de
around
nutrición.
the malnutrition
Y en la
issues.
adolescencia tenemos una situación
And
más
in the
crítica
adolescence,
para
we have a more
pasar
critical situation
lo que se mencionó también en otro momento, la importancia de
about
velar
regarding the
por la
importance
nutrición en el
of
curso de
making
vida. Y
sure
acá tenemos
of a good nutrition
información del
during the life
sobrepeso y
course.
la
And
obesidad
here we have
en niños de
information of
5
overweight and
niños
obesity
y niñas de
in
5 a 19
children from
años.
5 to 19
Estamos
years of age.
hablando
We're
de
talking
19, de
of
49 millones
49
de afectados.
millions
Y miren la
affected.
situación.
look at the situation.
25 países
Of
tienen
25
mayor o igual a
countries have
25%
25%
de
or more
prevalencia de
of
sobrepeso y
prevalence of
obesidad,
overweight
y
and
4
obesity,
países tienen
and 4
mayor a
countries have more than
35%. Y dentro de
35%.
los países andinos tenemos
And in
aquí
the Andean
Chile,
countries,
pero
here we
también
have
tenemos a
Chile,
México,
but
tenemos
we
a
also have
Bahamas,
Mexico,
Argentina, que
Bahamas,
son los más
Argentina,
críticos, pero
which are
si
the most
ustedes
critical ones.
observan,
But if
todos
you see,
realmente el color que se
all,
tiene, pues es una
depending
línea
on their
que muestra
color,
que
showed
tenemos que
us that we
ya
need
tener esta mirada
to
mucho
have
más integral.
this more
Y bueno,
comprehensive
acá solamente
approach.
para volver a
And
reforzar lo
here,
mismo,
just to
en el
reinforce the
mundo,
same,
en el mundo
throughout the world,
tenemos a nivel global
globally, we
sobrepeso,
have
obesidad en la niñez de
overweight and
5 a
obesity
50 a
of
19 años,
from 5 to 19 years of age,
18.1%, pero miren América
18.2%.
Latina,
But
¿no?
see that Latin
El
America
Caribe está
and the
acá,
Caribbean,
América
the
Central
Caribbean
y
is here,
América del
Central
Sur.
America, and
Entonces
South
sí es
America.
algo que nos está
So this is something
preocupando
that
a
is
verlo.
of
Yo quisiera
concern.
dar solamente algunas
And I would like
pinceladas,
to
que es muy
show
coherente
just a few
también con
examples
lo que ya se ha presentado de los
of what
marcos,
has been presented
pero una de las cosas
about the framework.
importantes
But
es
one of the
mejorar
important
la
things
buena
to consider
nutrición,
is to improve
dar buenos
nutrition, better
servicios
nutrition, provide good
y buenas
services
prácticas para que
and good
realmente la nutrición
practices
se mejore.
so
Estamos
nutrition can
hablando
be
de una
improved.
triada,
We're talking
pero
about a triad,
definitivamente esta triada,
but this triad
¿qué es lo que hemos visto en la
definitely,
práctica? Por ejemplo,
when
en
we
el Perú, en
see it
varias
from the
regiones
practical
del
point of
país,
view,
es que
in
no
Peru and other parts
combinamos
of the country,
el sumar el
that we
rompecabezas. Es
cannot
decir, tenemos
add this
alguna
puzzle.
pieza
We
buena,
have some
dos o
good
tres,
piece
pero
or
las
2
otras
or
no
3,
están.
but the
Entonces,
others are
eso
missing.
hace que
So
realmente
that
no
makes
logremos el
us that we
resultado
cannot
y por tanto el
achieve
enfoque es
significant results, and
prevenir
therefore
primero
the approach is
con
first
los
to prevent
programas que tengamos,
with the
acá estamos
programs that
hablando de
we have.
UNICEF, pero es en
We're
general,
talking about UNICEF, but
y
this is
hacer
in
plan
general,
tratamiento
and
cuando la
also
prevención
provide
fracasa, que
treatment
es lo que no queremos
when the
justamente.
prevention
Y
fails,
estamos
which is
hablando de este
something we're
curso
not
y
looking
de la
for. We're
importancia que
talking about
tiene
this life
que
course and the
problema de la
importance of
malnutrición
the
en la primera
issue of
infancia,
malnutrition in the
la prevención de
early
la
childhood,
hipertensión, anemia, obesidad y
prevention of
la
malnutrition,
preescolar y
anemia, obesity
adolescencia,
in school age and
prevenir la
adolescence,
desnutrición y la anemia
prevent
y la obesidad
malnutrition and
en
anemia and
madres
obesity
y
in
el bajo
mothers
peso al nacimiento,
and low
y
birth
la
weight in
detección
newborns,
temprana y
and
tratamiento de
the
malnutrición
early
aguda,
detection and
que ya
treatment
es
of acute
cuando de alguna
malnutrition
manera pues
when
hemos tenido una
we
situación que
have
no
had
hemos
a
prevenido.
situation that was
Y
not under
solamente
control.
reforzar que es muy
And to
coherente
reinforce
también con el
this
marco que nos han
with this
presentado tanto la
framework
doctora
that has
García
been
Casas
presented
como
by
la doctora
Dr. Garcia
Zabaleta,
Casas and
este
Dr.
enfoque
Zabaleta,
sistémico.
the
Esto hace
systemic
que sea
approach
complejo,
that
¿no?
makes
Pero
it
es
complex.
importante que todas
But
estas
it is
piezas
important that
sean
all these pieces
abordadas en un
are
territorio, en los
considered
territorios,
in
en las
one
regiones, en los
territory, in the
países.
regions, in the
Tenemos que ir
countries.
avanzando
We
para que
need to
cada
make
uno de ellos
progress
cumpla con
so each one
el
of them
factor que hace que
can
realmente
comply
tenga
with the,
efecto. Y yo quisiera,
so
ya
we
que
can
se ha
have an
puesto este
effect.
marco conceptual,
And
el
this
sistema
conceptual
alimentario
framework,
por la
we have
importancia que tiene
this is
y cada vez se le
the
está dando más
nutrition system
importancia de cómo este sistema
of how
alimentario
this
puede
food
hacer
system,
que lo que llegue finalmente
what
desde la
finally
producción, las
reaches
cadenas
from
de comercialización,
production,
los hábitos y comportamientos de
distribution
consumo que
chains,
tenga la familia,
food and
pero
habits,
también la
behaviors
estrategia
in
de
the family,
marketing,
and
que es una
also
de las
the
cosas que
influence of
estamos
marketing,
también
which
bastante
one of the things
preocupados,
that we we're very
compartimos esta
concerned,
preocupación con la
and
Organización
we're
Mundial de
sharing
la
this
Salud, está haciendo
concern with
que
the
finalmente
WHO,
lo
is that
que
making
llega
that at
al
the end,
plato del
what
niño o de la
reaches to the
niña
plate
no
of
es
the
saludable y
child is
mucho
not
de ello no llega a
healthy,
cubrir sus
or much of it
necesidades,
doesn't
¿no?
cover their
Por
needs.
tanto, solo tres resultados al
Therefore,
final que como UNICEF nos
3
hemos
flagship results
marcado para
that as
colaborar con
UNICEF
el
we have
mundo y con
to
los países y
collaborate
con
with the
los
world and the
gobiernos
countries
es que al
and the
menos
government
300 millones
that
de
at
niños y
least
niñas menores de 5 y
300
sus madres
million children at the
participen en
age of
programas
5
de
and their
prevención
mothers
de
participate in
desnutrición y
programs to
anemia,
prevent
que al
malnutrition
menos
and
200
anemia,
millones de niños
that
y
at
niñas
least
y
200
mujeres
million children at
igualmente
the age of 5
participen en programas de
participate in programs
nutrición y la
of
realmente
detection and treatment of acute malnutrition.
desnutrición aguda existe en América
And
Latina
there
y
is
Caribe.
acute
Nosotros la
malnutrition in
tenemos en Perú.
Latin America and the
No es un
Caribbean. We have it
porcentaje
in
alto,
Peru.
pero
It's
sabemos
not as
que un
high
niño con
percentage, but we
desnutrición
know that a
aguda
child with
se
acute
verá en
malnutrition
9%,
has
9 veces más
9%,
posibilidades
9
de morir
times
que un niño
greater
con
chance
desnutrición
of
aguda
death in a
moderada
child with
y
a
4
moderate
veces más
acute
posibilidades
malnutrition,
de morir. Entonces,
fourfold
realmente sí
increase
estamos
of dying.
hablando
So we're
también de una
really talking
preocupación que tenemos que
of a
abordar. Y
concern that we
recordemos
need to
que
approach.
como ya se ha
And
dicho, es
remember that, as
mixto.
it has been
Niño
mentioned,
con
this is
desnutrición puede
dual.
tener
A
anemia,
child with
pero
malnutrition
también un
can
niño
have
con anemia
anemia,
puede tener
but a child with
sobrepeso.
anemia can have
Entonces
overweight
sí
and
tenemos que
obesity.
mirar esto y
So
sobre
we
todo
need to look at
Los
this
problemas de
in a different
prevención
way,
de la anemia
especially when we talk about
en la etapa
prevention of
escolar.
anemia and obesity in
Yo
school
me
age.
quedo aquí. Muchísimas
That's
gracias.
it.
Y
Thank you very
sé que
much.
todos estamos
And I know that we're
interesados en seguir
all
realmente
interested in
apostando
following,
esta
betting
mejora de la
for this
nutrición y la
improvement
anemia en
of
América
nutrition
Latina,
and anemia
especialmente en América
in the world, especially in Latin America.
Muchas
Muchísimas
gracias.
gracias.
Thank you very much,
Excelente presentación.
Maria Elena, for your excellent presentation.
Estamos en el tema de anemia.
We continue talking about
Problema
anemia.
que
It's
persiste.
an issue that persists.
50% tiene
50%
nutricional.
of nutritional origin. And you have mentioned something of concern,
El tema de país, en Perú, el 50%
which
de
in
las
Peru,
familias tienen
50% of
alimentaria.
families have food
Entonces,
insecurity.
un enfoque de la anemia y
You
la
made
nutrición con
an
enfoque
approach of
sistémico.
anemia malnutrition by systemic approach,
Nos has dicho que
and you
27%
mentioned
a
that
nivel global
27%
de
globally
niños,
of
27%
children,
viven en pobreza
27%
alimentaria
live
infantil
in
severa.
severe
Esto
food
realmente
poverty.
pues, es
And that
preocupante
is
porque
really of concern
puede acarrear una
because
desnutrición
this may lead
aguda,
to
anemia,
acute
incrementar
malnutrition,
también
anemia,
mortalidad
increased morbid
en la
mortality
infancia.
in the early childhood.
Luego hemos visto en el video cómo
What we saw in the video,
se resalta todo lo que se
we
menciona
highlight
y
everything that has been
efectivamente
mentioned,
hay
and that
estrategias que podrían
there
plantearse
are
desde
strategies that may be
han
used,
planteado
as everyone has
diversa
proposed,
forma, en diversos
in different
métodos.
ways, in different
Una de las
levels.
cosas que nos
And one of
mencionabas
the
es
things that you
que se
mentioned
tiene que mejorar la
is that
oferta
we need to
de
improve
alimentos
the
saludables, porque lo
supply
que
of
más se
healthy food,
encuentra es
because what they
precisamente
mostly
el
find are
no de
things
consumir
that are
salud
not
para todos
healthy,
los niños, ¿no?
especially
Esto debe
children.
mejorarse, invertirse,
They need to
fortalecerse
improve
en
and
servicios
invest
de
in
atención
strengthened health
para que
services
puedan estar también
for
atendiendo
nutrition so they
a
can
las
also be
necesidades
alert
de la población,
and
de los niños,
providing adequate
y definitivamente
service.
un programa de protección
And
a
that we need
las
a
familias
social protection program for those families
pobreza.
who are in that extreme food
Nos has
poverty.
mencionado que en América Latina
You mentioned that in
la
Latin
malnutrición en
America,
niños, niñas, todavía
malnutrition
es
in
una
boys and
problemática,
girls
¿no? La
with a
malnutrición.
double burden of
Hay países
malnutrition. There are
con más de
countries
25%
with
de
more than
niños con más de
25% and others with more than 35%
de sobrepeso,
of
entonces
overweight and
es un
obesity. So
síntoma
that is an
que va avanzando
issue
silenciosamente
that
en
is
nuestra sociedad.
silently progressing, and we need to consider in order to fight
Nos has
against it.
mencionado y mostrado la estrategia de
You mentioned and
nutrición
showed
UNICEF
the
2020
UNICEF strategy in nutrition for
2030, en la que se
2022 to
recomienda
20
pues una buena
2030
alimentación, las buenas prácticas
with good
alimentarias,
good
servicios para
nutrition
lograr una
practices,
buena
services
nutrición
to
en
achieve
los
good
niños, los
nutrition
jóvenes, adolescentes y las
for
mujeres.
boys, girls, and
Y
adolescents and
todos hemos
women.
coincidido, nuestros
And
ponentes, que primero es
everyone has
la
coincided.
prevención,
First of all, we need to prevent
un abordaje sistémico,
with a systemic
un abordaje
approach,
territorial para
with a
poder
territorial approach to control this
reiteramos el
issue. Once
agradecimiento
again, thank you
a las tres excelentes
to the
ponentes
three excellent
que
presentations.
han llegado ya preguntas
We
y
have
felicitaciones para
questions
las tres.
and congratulations for you
Podrían, por
three.
favor,
I'm going to
prender
ask
sus
you
cámaras ya para
to
ir entrar
turn on your
en
video
el
so we
diálogo,
can
pero
go for
antes
the
queremos
dialogue and Q&A.
agradecer a todas las
But before,
personas
we would like to thank all the
conectadas
people
desde
connected
diferentes partes.
from different parts.
Déjenme ver acá que me
Let
han
me
llegado.
see.
A ver. Agradecemos a todos los
We
que están
thank
conectados
those
desde
connected:
Brasil,
Brazil, Bolivia, Chile, Colombia, Cuba, Guatemala, El Salvador, Ecuador, Mexico, Peru, Paraguay, and Venezuela.
Muchas gracias. Hemos
Thank you very
recibido
much.
ya las
We have
preguntas
received the
y podemos
questions,
también empezar
and we're going to start
a transmitirlas.
with them.
Bueno. ¿Cuáles son las intervenciones
What
más
are the
eficaces para
most
agilizar
efficacious interventions
el adecuado
to speed up the
el diagnóstico temprano y
the
tratamiento adecuado
early
y
and
oportuno de la
diagnosis and adequate treatment
tomando en
of
cuenta
anemia,
que hay más de una
considering
causa?
that there's more than one
¿Qué nos pueden
cause?
comentar al respecto?
What can you tell in that regard?
Yo podría comenzar, no sé si los
I
demás
will
quieren
start,
después enseguida
and you can
cualquier
follow
cosa.
my answer. Yes, go ahead.
Tenemos que ver
We need
desde los dos
to
puntos de vista, lo que es el
look from the
individuo
two
y
points
la
of view,
población.
the
¿Qué
individual
se
and the
puede hacer en un
population.
individuo? Muchas
What can
veces
we do in an
cuando vamos
individual?
a
Many more
visitar un
things.
centro de salud,
When they go to a
probablemente
health
un laboratorio y hay una
post,
cantidad de cosas que
there's
hacer.
a laboratory and many
Básicamente
things that
de
can be done.
hemoglobina, ferritina,
Basically, hemoglobin, ferritin,
para saber
inflammation markers,
y descartando el origen
and to
de
rule out
la anemia.
the origin of anemia
Deficiencia de
and to
hierro.
see if it's iron
Nosotros con
deficiency.
ferritina
But iron
nos dan
deficiency with
indicadores
ferritin doesn't tell us without
básicamente.
inflammatory
Esos son los
markers.
básicos
That is
también a
basically
nivel de población.
at the level of
Vamos a hacer toda
population,
la visibilidad
also
que se pueda
at the
de la
individual level,
determinación
and
de
if
cada
it is
parte del
possible
sistema
to
recetario de
determine
concentración de vitamina B12
folate, B12,
ver el origen.
to
Lo
see
lo que
the
perdemos muchas veces
origin.
es esa
What we
posibilidad de
many
mirar
times
a los
lose
ojos
is
a la
the
gente, de
possibility
ver
to
qué
look at the
puede ser
people at
esa
their eyes and
base.
see what could be the
Hay
causes.
inflamación,
There's inflammation, there's infection.
criterios a ir eliminando.
Those are
Cuando ya nos
things
vamos
that
un
need
poco
to
más
be
allá,
ruled out.
podemos hacer
When we go
metodologías
higher, we can do genetic
unos
markers
estudios
or other
mucho más
types of
sofisticados.
more sophisticated
El
studies.
ambiente, mirar a nuestro
The
alrededor,
environment, look
su
around us,
contenido,
the quality of the
el
water,
hierro en el agua,
the iron content in water,
los aspectos sanitarios
the health
de las cosas. Y
aspects of
luego la
things,
salud, la educación
and
y la
then
salud
education
para el
and health to the school age,
y a la
preschool
mujer
age,
en edad
and
reproductiva.
to the mother in
Bueno, la
reproductive
lista es
age.
larga. Compañera,
Well, this is a long list. Now,
Yo quisiera
Gracias.
agregar a lo
I would like
mencionado por la doctora
to
Casal,
add to what mentioned by Dr.
tenemos que trabajar
Garcia Casal.
desde la
We need to
gestación
work
o tal vez
from
un poco antes,
pregnancy
pero
or even
digamos
before.
en la etapa de la
But in the
gestación,
stage, in
el
the
cuidado
pregnancy,
prenatal,
the prenatal care
bueno, con todos los protocolos de manejo
with all
del
the
gestante, pero quería reforzar que en esa
management
etapa
protocol, but I would like
hay
to
que
reinforce that at that
asegurar,
stage,
digamos, que la
we
mujer
need to
gestante
make sure
tenga
that the pregnant
un
woman
suplemento
has
de múltiples micronutrientes,
a
porque hay
multiple
evidencia que
micronutrient
eso tiene
supplementation
un efecto
because there is
favorable
evidence that has a
y va a contribuir no
favorable
solamente
effect.
para
It's going to
la
contribute
nutrición de la gestante,
not
la
only
mujer
for nutrition
gestante,
of the
sino
pregnant
también va a
woman,
transmitir
but also
mejora de
is
salud
going to
para el feto.
provide better reserves
También
for the
preparar a
fetus.
la mujer en la
And
gestación
also
para la
prepare women
lactancia,
during pregnancy for,
porque la
prepare her
lactancia
for
exclusiva
lactation
los primeros
because
meses de
exclusive
vida
breastfeeding in
va
the
a
first
reducir el
months of
riesgo
life
de
is
anemia.
going to reduce the risk of anemia and protect
La
the
atención
child.
al parto, que también hay
Part
estrategias
delivery with
como el clapaje
strategies
oportuno,
at the
y luego ya en
timely
la etapa
clamping
de la
of the
alimentación
cord, and
complementaria,
also during complementary
promover
feeding,
una alimentación
promote
saludable,
healthy
rica en
nutrition,
micronutrientes,
rich in
y también
micronutrients,
considerar,
and
digamos,
also
estrategias como la
consider
fortificación
strategies such as
de alimentos,
fortification
pero
of
especialmente
foods,
formulados para
specially
niños sobre todo,
formulated for
para
children,
aquellas poblaciones con alta
especially for those
vulnerabilidad, ¿no?
populations with high
Entonces, para aquellos
vulnerability.
niños, digamos,
So for those
zonas
children in
de
areas
alta prevalencia, también hay
of
que
high
considerar
prevalence, we need to
la
consider
mejora de la calidad
the
de
improvement
las
of
atención de salud,
the
como por ejemplo los
healthcare,
servicios
such as
de CRED, que son los de crecimiento y desarrollo
growth and development
para el niño
services for the
el
child
tratamiento,
and
diagnóstico y tratamiento
the
oportuno de las
diagnosis and
comorbilidades.
treatment of
Eso
any
eso es
comorbidities.
lo que agregaría
This
a
is
lo
what
que
I will
mencionó
add
también la
to
doctora.
what
Gracias.
Dr.
Sí,
Gracia
muchas
Casal
gracias. Un
mentioned.
comentario breve,
Thank
no
you
más
very
que
much.
mencionar
A
que
brief
sí es muy
comment just to
importante
mention that it
mejorar el
is
sistema de
for
atención
the
primaria de
to
salud
improve
en
primary
su
health care
articulación con un
and
nivel
the
de mayor
coordination
complejidad,
with a
que a veces
higher
no llega a
complexity
pasar.
level, which
Debemos
many times doesn't
ver,
occur,
ver
and we
esta
don't
conexión con
see
los sistemas
these
más
connections with
especializados.
the most
Y lo
specialized
otro es la
systems.
parte
And the other
comunitaria.
thing
Quisiera
is the
resaltar la
community
importancia
portion. I would
del
like to highlight the
trabajo
importance
con la
of
familia,
the
con la
work with the
comunidad.
family, with the
Vemos
community.
demostrada las visitas
It's been
domiciliarias
seen that
por personal
home
de
visits
salud, por
by
agentes comunitarios,
health
bien
staff
preparados y con material que les
is
permite
very
llegar
well
a las
prepared and
familias.
material that
Creo
may
que
allow them to
tenemos
reach
varios aspectos,
families.
además de los ya
So we have
mencionados,
several
pero
aspects
la
about,
atención comunitaria
in addition to already
en
mentioned,
nuestros
but the
países
community
tenemos un
intercultural
desafío
area,
enorme que tenemos que tenerlo muy en
we in our
cuenta
countries have
para las
these
estrategias
cultural
de
issues for
cambio
that we need
social
to
que
consider for the
necesitamos tener.
strategy for social
Gracias.
change and behavioral change. Thank you.
Muchas gracias.
Thank you.
Creo que la anemia ha sido
I think that anemia has been very well studied and investigated, and you have shown a lot of knowledge in this area. If if we already know what to do, why do we still have so many issues with severe anemias in countries? What do you think is the cause? Or what's missing? What recommendations would you make?
Sí, como usted dice,
Yes, as you
sabemos qué
mentioned,
hacer, pero
we know what
en
to
cómo
do,
hacerlo está la
but in how to
dificultad.
do it is the issue.
Y el cómo, digamos, es
And
adecuar estas
how is to
recomendaciones
adequate these
hacia algún
recommendations
territorio. Y hay territorios que
in the
son mucho más
territory.
difíciles,
And there are areas that are
donde
much
se
more
implementar
difficult
estas
to
intervenciones de las que
implement
venimos hablando.
interventions that we're
Y son
talking
en
about.
donde justamente
There
creo
are
que
areas
los
where
órganos
have a systemic approach. So the quality of health services, the nutrition systems, where it's more difficult to carry out these interventions, but that doesn't mean that that means that we need to keep fighting in the implementation of these strategies, but in a coordinated manner with a systemic approach. That is important.
Sí, bueno, agregar que
We would
realmente
like
esto
to
es
add that
un problema muy complejo, es uno de los
this is a very complex issue.
de los problemas
One of the
justamente
problems that precisely
si se quiere
because
los síntomas y los signos son
if we want, the signs and
inespecíficos en
symptoms are
algunos
quite
casos
inspecific in many
las
cases,
consecuencias son muy graves,
and the consequences are
afectan de
serious,
manera aguda,
but they don't
es
affect
que es
acutely.
increíble que después de
Is that
tantos
it's
años de
incredible
esfuerzo,
that after
nosotros
so
no
many
podamos
years of
encontrar en
effort,
algunos
because
países más que
many
otros.
efforts have been done,
La verdad es que
the
nosotros
truth
hemos
is
logrado
that we not only
mantenernos
we have been able to keep
un plató
in
completamente,
a
sino que ahora
plateau, but
comienza levemente a
we start to
aumentar
see a
la
slight
anemia.
increase of anemia.
Está
Severe
controlada.
anemia
Ahí hay
is
algo
controlled. I think that here we have something
Lo
that's
que comenta
multifactorial.
Nelly, absolutamente de
What
acuerdo.
Nelly mentioned, I
También hay
absolutely
otros
agree.
aspectos, por ejemplo,
There are other
cómo estamos
aspects such
midiendo
as
hemoglobina
how we measure in
comparado
hemoglobin
con cada
against
cosa.
what are we
El uso de
comparing each
sangre
thing.
venosa es crítico,
The use of venous
importante,
blood is
o por lo
critical,
menos
it's
saber
important,
dónde estamos
or at
parados.
least to know
Por
where are we
ejemplo,
standing.
revisando los datos,
For example,
Mónica
reviewing the
Flores
data,
podrá, no sé si
Monica Flores, I don't
podrá
know
intervenir,
if
pero
she
en
could
general
say, make a comment,
estamos
but
trabajando y haciendo
we
esfuerzos.
are working and making
Buscamos los datos,
efforts.
por ejemplo, de Perú.
We're looking
Perú
data
en los
from
años
Peru,
2000
and Peru in the year
trabajó con sangre
2000
venosa
worked with venous
una vez
blood
en niños y al siguiente en
in
adolescentes
children and
en
in
mujeres, y luego
adolescent
se
and in
cambió
women,
a
and
capilar.
then
Ahora
they
hacemos un
changed to
cambio
capillary.
capilar.
The reasons for changing to capillary blood are perfectly understandable, but we need to review that. We need to review that my reality is not the same of my neighboring country or others. There's similar things. We need to look at the countries and see what the progress made, to see what they're doing and what can we do, the other countries, to achieve that. It is very difficult because a major efforts being done. There's a beautiful plan of attacking the anemia, but when we go to the reality in the field, we don't get the supplement or the fortified food because the vehicle that was bringing it didn't come. Things so simple but so serious. So this is an accumulation of things that make it so complex, and that we need to be considered in a multifactorial way by in order to have success, because with all the effort done, it should be a lot better in terms of that prevalence. And then the classification, moderate and severe, is clear. The gray area of mild anemia,
Leve.
Allí hay algo también que podemos atacar.
there's something that we can tackle and think how to act upon that. Yes, I would like to refer to this aspect of coordination, because it is true that we know, and now with the framework to accelerate anemia reduction by WHO, this is going to refine the action plans that are being drafted in countries. But the issue is that not all necessarily are providing their quota. How we are improving in terms of water and sanitation, how are we doing in improving family agriculture, how we improving nutrition system. So we do need to have an intersectoral commitment in the plans, because sometimes it's been left at the health sector that are responsible in reducing anemia, where we know, and as we reaffirm, that that is not the case. So there needs to be a clear commitment with clear indicators, with the plan that Peru has, but needs follow-up and monitoring. And there needs to be a measurement that allows us to see how we are influencing different factors. Thank you. Thank you. The changes in the cutoff points are going to increase or decrease the anemia. What strategies do you recommend for this transition? What technical aspect should be strengthened in order to adequate the new guidelines that have been issued? Well, the first thing I would offer in help from the WHO to my friend Leon Edervin, who's present here. He's 100% with this, agree with these guidelines, and we're ready to listen to the countries, to the regional offices, in anything that we can support. In general, the implications of the changes that I mentioned during my presentation are that less children from 6 to 23 months are diagnosed with anemia. I was surprised, Nelly, by the analysis that you did. For example, that under 60-30, but there is the exercise where you see that can not only apply the cutoff point, but also the adjustment by elevation or smoking nuts in the case of children, but all the adjustments that can be done. And what does that mean? That is an exercise that needs to be done by each country, where WHO is ready to collaborate and to orient if they use the formula, if you use the tables, any help that we can offer through practical exercise seminars or just emails directed to us, we will support. The practical consequences of what we demonstrated are less children from 6 to 23 months with diagnosis of anemia, less pregnant women in the second trimester with a diagnosis of anemia, more population that live between 3,000 meters, and this is an important adjustment by elevation. That is the reason by the result of Puno. I don't know how high it is, but that would be the reason are going to be, they're going to have a higher prevalence of anemia. And in general, less population that lives below 3,000 meters are going to be affected, so there's going to be a decrease of the prevalence. In the case of smoking, which is not recommended by any level, but associated to a reality, perhaps there's no major changes in the adjustments by smoking. Those are the expected results of the changes that we have introduced with the new guidelines. Just to mention that there's going to be a change in the configuration that Nelly mentioned, how the configuration is going to change, and that has implications for territorial decisions, national, but also in the territories, but also something very important that we need to carry out an analysis. The country has to carry out an analysis and provide official results, but also make an adequate exercise of communication, because if we don't do adequate communication, we may say that anemia has been solved in the country, it's much less, and therefore it's not a significant problem. So it is very important to consider how we're going to communicate, how we're going to tell this to the authority, to the technicians, but to the population in general and to the media. I would like to also consider that. That is critical. Not say that apparent anemia has decreased in children less than 2 years of age. That's not true. There's a new cutoff point, and if we apply them, this is what happens. What Marilena just mentioned is extremely important. Yes, it is important because we had an experience when they issued a new cutoff points for weight and height. And for several years, the National Statistics Institute published the data with the old tables, the NCHS. So that was need to be adequately interpreted because the cutoff points changed, but the interventions are not being the best as we would like. So perhaps it's going to encourage us to have a territorial approach and to look beyond the determinant factors of this anemia region by region and tailor and work in that regard. But we still need a lot of work to do. Also, in terms of the transition that I would like to propose to this region about from venous to capillary, if there's any change, if the new surveys are done with venous blood or a subsample to match the previous statistics to look at those changes, from one to other.
inclusive
que
hacer
en las
bolsas
zonas,
pareadas o cosas como esas para saber.
Things like that.
sí,
Yes.
hay que ir trabajando eso.
Yes,
Esa
we need
parte
to work.
logística es un poquito
The logistic
complicada y
portion is somewhat
engorrosa.
complicated with
Sí,
venous
no
blood.
solamente es en las técnicas
It's not only in
de
the
muestreo, sino en el
techniques of
procesamiento de
sampling, but
muestra,
also in the sample
la
processing,
aceptación de la población
the
y todo ello.
acceptance by the
Pero
population.
ya
But
iremos probando, como dices, quizás
we
en
will
algunas
be
regiones
testing
para
perhaps in
ir
some regions
Muestras, ¿no?
and to
sí,
compare.
una muestra,
Yes,
sí.
Ah, ok.
Sí,
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 a
ese es un
sample.
buen punto.
Yes.
definitivamente que el mapa va a cambiar.
Well, the map
Y
is going
ese
to
tipo de
change,
planteas
and
es
what you propose, Marilena, is critical.
Sí.
para los tomadores
Location
de decisión
for
y
decision
la
makers
población,
in the
definitivamente.
population.
Bueno, para ir
Well,
ya nos estamos acercando al cierre.
we're running out of
¿Cuáles son
time.
los retos comunes para el
What are the
abordaje de
common
la problemática
challenges
de malnutrición?
to tackle
Con
malnutrition?
deficiencia de minerales, sobrepeso, obesidad.
Mineral
¿Qué decisiones
deficiencies,
prioritarias se
overweight.
deben tomar al
What
respecto?
priority decisions must be
Y yo
or
quisiera
should
ahí
be taken?
comenzar, es decir,
Where I
que
would like to
de lo que
start.
hemos podido mirar,
What we've
hay
been
un
able
enfoque
to see
claro de
is that there is
prevención
a
y de
clear
curso de vida.
prevention
Y
approach
creo que
in
eso es
life course
fundamental. Y
that
cuando
is
uno habla de
of
prevención, por ejemplo,
utmost
me refiero a
importance.
la
And we
primera
talk about
infancia,
prevention.
la
I'm talking
lactancia
about the early
materna, la
childhood,
alimentación
considering
complementaria,
breastfeeding,
influye
complementary
sobre
feeding,
todos los
has
problemas de
influence on all
malnutrición.
the
Son
malnutrition
intervenciones
problems.
que le llamamos de doble
These are
vía.
interventions that we
Entonces
call
es muy
two-way
importante
interventions. So
que
this is very important
no tengamos planes para anemia
not to
o
have
para
plans for anemia,
obesidad,
plans for overweight,
sino
but
podamos cada vez
to
más ir construyendo
be
un plan
building
nacional de
a
nutrición
national nutrition
que nos
plan
apoye, digamos, o que nos
that
ayude a prevenir
supports or
todos los
helps us
problemas
to
de
prevent
malnutrición,
all the
además de otros
malnutrition problems
aspectos.
in addition of other aspects.
Sí, sí, totalmente de acuerdo en el enfoque
Yes, fully agree in
de
the
prevención y de curso de
prevention
vida
approach during the
y
course life,
realmente agregaría también la
and I will
investigación,
add
¿no? No dar las cosas
research,
por supuestas y que funcionan,
not
sino
take
que
things
ir
for
hacer un
granted, but go
acompañamiento y a ir
and accompany
investigando
and
por qué no funciona
investigating why
también
it
y
didn't
tomar las
work
medidas correctivas,
and
¿no?
taking the
Entonces
corrective
eso
measures.
también
So it is
requiere una
important
evaluación
the
constante.
monitoring and evaluation on a constant manner.
Gracias.
Thank you.
Lo han mencionado, pero de repente hay
It has been mentioned, but perhaps we should emphasize
¿qué repercusiones tiene la anemia
what
en el curso de
repercussions
vida?
does anemia
¿Puede
have during the
estimar
course of life.
la
Can
pérdida
we
económica que
estimate
genera
the
la anemia
economic
según el
loss
nivel
generated by
de
anemia
prevalencia en la
according
salud
to the
pública,
level of
sea
prevalence
leve,
in,
moderada o
in
severa?
public health in mild, moderate, or severe?
Ese ejercicio intentamos hacerlo
We try
para
to do that
establecer, bueno,
exercise
la
to
carga
establish
de
the
salud pública de
burden
la anemia.
of
Y sí,
anemia on public
hay
health. And
los
yes,
daily,
we have the
los datos en
DALIs
disability, en disabilidad, y
and
hay datos que muestran
there
por
is
eso la
data
importancia.
and therefore the
Sin embargo, como
importance.
para hacer el
However,
cambio a
in
la
order to make the
hipertensión, la
switch
severidad,
to
los
the
datos
different
no
levels of
no eran
severity,
suficientes.
the
Pero
data
sí
were
hay
not
datos
sufficient.
socioeconómicos,
But do
sobre
we
todo
have
rendimiento escolar, y
socioeconomic school
hay
performance? We have
eh, claras tendencias a
several
no
clear
suficientes
trends
por lo menos en esta
that are
revisión de las directrices
at
para hacer los cambios, pero definitivamente sí.
but we
Sí,
definitely
también
need to consider that.
hay una investigación que realizó una
There
doctora
is a research done by
de
a
Grade
doctor in
sobre el costo
Grade
económico de la
about
anemia
the
y es
economic
una
cost of
publicación que
anemia,
se puede encontrar,
which is
no
a
tengo la fecha
publication.
exacta,
I
pero está
don't have the
publicado
quote right now.
y sí puede
It
generar
has been
un,
published
un
that
costo,
anemia
digamos,
does have a
en
cost
el país, que no
to
solamente
the
en los
country,
individuos que la
not
padecen,
only in the individual who
también
suffer
hay
and their
un
families,
estudio
but also
sobre el
there's a
costo
study
económico
about
también
the economic
de la
cost
malnutrición, no solamente de
of
la anemia,
malnutrition, not only
del Programa
anemia,
Mundial de Alimentos. ¿Esa
published by
parte
the
aparece
World
en
Food
sus
Program a couple of
diapositivas?
years ago that
Es
can
que
also
no
be
solamente
found.
las evidencias pues
And
están
not only
a
the
nivel
evidence
individual, sino
is at the
también
individual level, but also
nacional
at the
y
population
cómo la
level,
anemia está afectando
and how anemia is
la economía y el
affecting
desarrollo del
the
país.
economy and
Y yo
development of
sí
the
quisiera
country.
agregar algo ahí
I would
importante.
like
Es
to
decir,
add
nosotros hemos
something
podido,
important because
no es un estudio exactamente, pero
this
hemos
is not
visto
a
una
study in
coincidencia
itself, but we find
entre
a
los
coincidence
niveles de aprendizaje
between the
de
learning
escritura y
levels
matemática
in
y la
reading and
prevalencia de
math
anemia. Y
and the
uno
prevalence of
mira
anemia.
realmente
And
donde
you
hay
can
más
see
anemia
where
en la
there's
primera
more
infancia,
anemia
terminan
in the
teniendo
early
más
childhood.
problemas
We
de
have
aprendizaje.
more
Entonces,
issues
estamos
in learning.
notando, pues
So
definitivamente
we
un
are
problema que está afectando de todas
considering
maneras el
a
aprendizaje
problem
y
that's
después la
affecting
capacidad
learning
productiva
and then
de las
productive
personas
capacity of people.
niños y adolescentes también.
Gracias. Y ya para
Thank you.
ir terminando, una
And to
penúltima pregunta.
Another
¿Cómo el cambio
question,
climático está
how
afectando
the
las estrategias de
climate change
erradicación de la anemia
is
y
affecting the
otros
strategies to
problemas?
reduce anemia and other malnutrition issues?
Bueno, el cambio climático
Well,
va a
climate
afectar,
change
digamos,
is
la
going to
producción de
affect
alimentos,
the food
¿no?
production,
La producción de algunos alimentos
the production
probablemente
of
van a
some foods
desaparecer, otros
perhaps are
no,
going to disappear,
y
others
esto
are going to
va a
decrease,
limitar el
and
acceso
this
de
is going
las
to limit
personas, digamos,
access
a estos alimentos y
of
afectar su
people to
estado
those foods and
nutricional, ¿no?
affect their
Por el
nutritional
otro lado,
status.
también
On
nuevas
the other hand,
enfermedades pueden
new
emerger,
diseases may
van
emerge
a aparecer otras
because
infecciones
we're going to
virales,
see other viral
porque va a
infections,
haber movilización,
because there's going to
¿no?
be
Entonces, por el lado de la
mobilization.
salud y por el lado de la
So in terms
alimentación,
of
esto
health
significa
and
que nos puede
nutrition,
afectar
climate
el
change,
estado
it is
nutricional.
going to affect
Y yo
nutritional
solo voy a decir
status.
una palabra, agua.
And I just say one word, water.
¿Sí?
Sí, yo quisiera
Yeah.
decir otra
Yes, I
palabra,
would like to mention another word,
emergencia, porque
emergency,
hemos visto en Perú
because we've
emergencias de
seen in Peru
inundaciones,
emergency due to
de
flooding
incremento de
and
metaxénicas,
increase
dengue
of
y otras
metaxenic,
enfermedades.
dengue, and other
Sí
diseases.
hay más riesgo también de
So there is
malnutrición, de malversación
higher
de
risk
alimentos. Sí.
of access to food.
Gracias. Y la última pregunta.
Thank you. And the final question.
¿Qué mensajes para prevenir,
What messages, what clear messages to prevent and reduce anemia should be clear for the authorities of the countries and for the civil society?
Yo transmitiría que la
Well,
anemia
I
afecta
will
el
say that
desarrollo
anemia
de las
affects
personas,
development of
limita su
people,
potencial
limits
y
their
también afecta
potential,
el desarrollo
and
del
also
país,
affects
¿no?
the
Entonces
country's
tendríamos que tener
development.
un enfoque,
So
las
we'll have,
autoridades un
the
enfoque
authorities
de la
should
anemia
have
en la lucha
an
contra la
approach of
malnutrición y
anemia
la
in
mejora del
fight against
desarrollo del
poverty and in
capital humano.
improving development of human capital.
Yo iría por un mensaje de
I
inversión,
will go for a message
¿no?
of
Inversión
investment,
real, inversión
real
monitoreada y
investment
monitoreo.
and
Monitoreo
monitoring.
para poder ver qué funciona,
Monitor
qué
to
no
see
funciona,
what works and what
porque muchas
doesn't,
veces terminamos
because many
delegando. Yo
times
creo que
we
sí
end
tiene
up
que haber una
delegating. So
responsabilidad
there needs to be
tanto
a
a nivel
responsibility at a high
político-técnico también,
political
no
level, high
solamente a nivel
technical level,
nacional, sino a nivel
not only
territorial,
national level, but also
para que
territorial,
podamos hacerle
so that
seguimiento
we
y
can
podamos
provide
poner la
follow-up
inversión adecuada.
and put the adequate investment in
Yo,
place.
sí, de acuerdo con
Yes,
todo, pero
I
también
agree with everything, but also I will
un
add
mensaje así de llegar
as a message
que afectas al individuo, a la
that you
familia, a la
affect the
comunidad,
individual,
a
the
la
family, the
población, al
community,
país,
the population, the
porque
country,
la posibilidad de
and
desarrollo
make that a possibility of
en
development
y alrededor de tus vecinos y en el mundo
around your neighbors and in the world in general
como
puts you in
individuo y
disadvantage
como toda la
as an
cadena
individual
nacional.
and with all the chain that I just mentioned.
Muchísimas gracias a cada uno
Thank
de
you so
ustedes. Y
much to
para
each one of you.
despedirnos
And to say
del
goodbye,
por favor, les pedimos un
please,
minuto
I
de
will ask you
reflexión final
1
para
minute
poder
of
ir
final
hacia la
comment
presentación. Empieza la
in
doctora
the order of
Casal,
presentation. We start with
luego
Dr.
Nelly
Casal, then
María
Nelly,
Elena.
and then Maria Elena.
Pues que
Well,
a pesar de todo el esfuerzo,
despite all the effort,
si seguimos
if
entendiendo
we
la anemia y
continue
haciendo cada vez
understanding
mejor,
anemia and we understand it
podemos
better,
actuar sobre ella
we can
en
act
la medida en
upon
que
it to the extent
unamos esfuerzos,
that
que
we
trabajemos
unite efforts and not work
digamos,
in isolation.
aislados de la población. No es fácil, es
It's
multifactorial,
not
pero
easy, it's
es
multifactorial,
posible
but it is
hacer
possible
algo
to make
con
something
respecto a la anemia.
with regards to
Y que
anemia.
por favor estamos a la
And that
orden para
please, we
cualquier
are
apoyo que
ready for
necesiten
any support that you
nosotros
need
como
from
OMS.
us as WHO.
Yo lo que diría es que
I would say
ya
that
sabemos cuáles son las
we know
estrategias
what are the
efectivas,
effective
eficaces, perdón. Lo que creo que tenemos que
efficacious strategies.
esforzarnos a
What we need
hacer que
to
estas
put our
estrategias sean
effort is to make
efectivas
those
y
strategies
creo que
to
todos
be
unidos, si
effective
nosotros
and all
logramos
together.
llegar,
If we
digamos, a
propose it,
tener
we
ese
can
30% y
reach
otros
that
países lo han
goal
logrado
because
controlar la
other
anemia,
countries have been able to
también
control the
nosotros
anemia.
podríamos
So
y
we could
países
also
andinos
do it.
también controlar
The
la
Andean
anemia.
countries could also
Ese
control
es
the
mi sueño.
anemia. That is my dream.
Sí, bueno, y yo finalmente decir
Well,
un
finally, I would
abordaje
like to
integral.
say a
Necesitamos un
comprehensive
abordaje
approach.
integral
We need
y
comprehensive
monitorear para
approach
ver cómo
and to
vamos
monitor to
avanzando,
see how we're
¿no?
making
Y otro de
progress.
los aspectos es
And
poder
another of the
ir a los
aspects
territorios,
is to
apoyar,
go to the
apoyar
territories,
a las
provide
autoridades, a
support
los
to the
técnicos a nivel
authorities, to the
territorial,
technicians
para
at the
que vayamos
territorial
teniendo
level,
buenas
so we can
experiencias.
have
Las
good
tenemos en el país, son muy
experiences.
focalizadas, pero necesitamos
We have
expandir.
good
Y
experiences that are
también
focalized. We need to
igual
expand that and
ofrecer siempre
also
el apoyo
offer
técnico
always
del
technical
Fondo de Naciones
support
Unidas para la
from
Infancia
the from
a
UNICEF
nivel global, a nivel
at
regional
global level, at
en
regional
países
level,
como Perú,
and I,
estamos
as
para
Peru,
servir
here we are to
a
serve
este reto enorme que tenemos
to this
en
major challenge that we
Latinoamérica.
have in Latin America.
Muchas gracias. Agradecemos
Thank
las
you.
preguntas
We
realizadas.
thank for the
No
questions
alcanzamos a
sent.
responderlas
We were not
todas,
able to respond
pero
all,
siempre las vamos a
but
considerar
we're
para
going to
definir
take into
nuestro
consideration
punto de
to
vista.
define the following topics for
Valoramos su
for the,
participación e
and we
interés.
value your
Reiteramos el
participation and interest.
agradecimiento por las
We
brillantes y
thank
excelentes
once again for the
exposiciones del día de
excellent
hoy.
presentations
La doctora
today.
María Nieves García Casal,
That is
doctora
María
Nelly
Nieves García
Zabaleta
Casala,
y
Nelly
Marilena
Zabaleta, and
Ugas.
Marilyn Ugas.
Gracias a todos los
Thank you to all
participantes,
the
al coordinador
participants,
ONU,
to the
a
Horas
toda la
Conu
persona
team,
que
and to all
participó en
the
la
people
actividad
who
que ha sido
participated in
posible
this
gracias
activity
al
that has been
compromiso con la
possible thanks to the
cooperación andina y
commitment with
latinoamericana.
Andean integration and Latin
Para el
American integration.
cierre
To close,
institucional, cedo la palabra a la
I
señora
give the
María
floor to Dr.
Carmen
Marcarmen
Calle,
Calle,
secretaria ejecutiva del Horas
Executive Secretary of the Horas Conu. Go ahead.
Gracias, Marisela. Bueno,
Thank you,
primeras
Maricela. My
palabras son
first
de
words
agradecimiento
are to thank
a María García, a
to
Nelly
Maria
Zabaleta,
Garcia, Nelly
Marilena Ugas.
Zabaleta, Marilena Ugas.
Realmente han sido 2 horas de
It's
mucha
been 2
información,
hours of
pero no solamente
much
información,
information,
sino
but not
de
only a lot of
qué hacer,
information,
qué tenemos que
but
hacer,
also what's
¿no?
pending, what do we need to
Como
do.
decía Nelly, sabemos qué
As
hacer,
Nelly
pero no
mentioned,
siempre
we know
cómo
what to
hacerlo.
do, the problem is how to
Y
do it.
como decía María,
And
bueno,
as
para
Maria
poder hacer
mentioned,
una
well,
atención
in order
individual
to
se
make
necesita
individual
esto
care,
y esto,
we need this, and that.
definitivamente esto y esto
But
no lo
this, and
tenemos
that,
nosotros
we don't
en
have
todas
it
las partes de nuestro
in
país.
all the parts of our
Sin
country.
embargo, yo siempre pensaba que
However, I always
sería,
thought that we
debe
need to
ser,
think
¿no?
it
No en
must be,
que puede ser,
not
sino
in
que
that
debe
maybe,
ser.
but must be.
Y tenemos que comenzar
And we need
reconociendo
to
que la anemia
start
es un
by
problema de salud
recognizing that
pública,
anemia
que la
is a
anemia no
public
viene
health problem,
sola,
that anemia
que
doesn't
la
come
anemia
alone,
tiene que ver con
that
insuficiencia
anemia has to do with
alimentaria, que
food
la anemia tiene que
insecurity,
ver con
that
pobreza
anemia has to do
alimentaria,
with
la
food
anemia no va
poverty.
sola, ¿no?
Anemia doesn't come alone.
Así como no va sola, eso quiere decir
So,
que es
therefore,
multicausal, pero que
it is
va acompañada
multi-causal,
de muchas
but
cosas.
it's accompanied by many
Si
other
hablo de
things.
cambio climático,
If
yo
I talk
me
about
estaba
climate
escuchando
change,
porque no habían dicho a cambio
I was
climático, pero
just
luego
listening.
dijeron hay que
But
hacer una
I was
relación
gonna,
con todo el tema del
we need
cambio
to relay
climático
that
que nos
the
está
climate
golpeando
change
en
that
todo el
is
mundo,
hitting us
pero de
throughout the
manera
world,
especial en América
but
Latina.
especially in Latin
Así
America.
que, y lo que decía Marilena, la
So
emergencia,
what
¿no?
Marilena mentioned, the emergency,
Hay zonas devastadas
there are
por los
areas that have been
cambios climáticos.
devastated
Es
by the climate
todo un tema.
change issues.
Todo lo que se ha dicho es sumamente
Everything that
interesante.
has been said is extremely
Me gustó
interesting.
el hecho de
I
que
liked the
sea
fact that
María García Casal quien nos
Maria
cuente
Garcia
cómo se
Casal, who
decidió,
told us
porque,
how
bueno,
she
es
decided, how it
parte
was
de la voz
decided. Well, that's
autorizada
part of the
a nivel
authorized voice
mundial y a nivel de la Organización
worldwide
Mundial de
and
la
at the
Salud.
level of the World
Y lo que nos
Health
dijo
Organization.
fue que sí, todo esto se
And
va a
what she
hacer
mentioned is
público.
that, yes, this is
Y cuando no hay
evidence-based.
suficiente
And when
evidencia,
there's
pues
not
no se puede hacer
sufficient
nada.
evidence, we cannot make
Eso ha
any
sido muy
change.
clara y yo creo que
And
ese es
that
el
she's been
primer
very clear in that.
mensaje.
And that's the first message.
Digamos, cuando se decide hacer los cambios,
When
se
we
decide
decide to make the
porque
changes with
porque
the
se ha
cutoff points,
estudiado
it's
la
because it's been,
situación, ¿no?
the
Y
situation has been,
porque se sabe cómo es la situación
it's because
y
we
hay
know
evidencia
about the
científica de
situation
eso.
and there's clear
Sin embargo,
scientific evidence.
lo
However,
mencionó Nelly, y eso
Nelly
nos pasó
mentioned,
a nosotros los
and that
pediatras,
happened to
nos
us, the
pasó hace unos
pediatricians,
años,
a few
cuando
years
se
ago,
cambiaron,
when we
¿no?
switched
Se cambió
all
todo,
the,
de
everything was changed
NHS
from
a
NCHS
todo lo que hizo OMS.
to what
Y no fue
WHO
fácil.
did. It was not
La
easy.
transición no fue
The
fácil
transition
porque
was not
ni
easy
siquiera hace
because
el INEI publicaba los
even the
resultados con las dos
statistic
formas de medir.
institution
Entonces yo
published
pensé,
the
no vaya a ser que
results
el
with the
INEI
two ways of
también
measuring.
comience
So
a
maybe now
publicar
the
con las dos
Statistic
formas.
Institute of Peru is going to start
Pero lo
publishing with the
concreto
two
es
cutoff
que ya
points.
hay normativas
But
que están
the concrete
saliendo en
thing
los
is that
países, hay normativas que están
we have
reconociendo
standards that are
estos puntos de
acknowledging
corte.
these new cutoff
Y hay
points,
que ser
and
muy
we need to be
cuidadosos
very
en la
careful
parte comunicacional,
with the communication portion
porque el tema de Puno es un
because
tema terrible,
Puno
¿no?
is a
Digamos,
terrible case
aparte que Puno es puerta de entrada para
because
todo. Ahorita
Puno is
tenemos
the door
sarampión
for
en
everything. We
Bolivia,
have measles in
las
Bolivia,
coberturas no están muy
the
buenas, y
coverage
si
are
le
not that
agregamos
good, and if
anemia
we add
y
anemia
descuidarnos de la anemia y la
and
desnutrición,
forget
hacemos bicho.
anemia and malnutrition, we will
Creo
get into
que
trouble. So
este webinar
this webinar
nos hace recapacitar
makes us
que
think or rethink
definitivamente la
that
anemia es un problema
anemia is
severo de
definitely a
salud pública.
severe public health
Porque
issue
ahí están los números
because
no
we have the
mienten.
numbers. The numbers
Y
don't lie.
Marilena se puso todo el
And
foco en América
Marilena
Latina,
put the Latin
¿por qué
America
se
map,
daba la anemia sola?
and it's not
Tenemos
anemia doesn't come along. You have overweight and
y aparte
obesity,
tenemos
and in addition,
micronutrientes.
we have micronutrients.
No solamente es
So it's not only
¿no? Ya
double
estamos hablando
phase,
de
we're
triple
talking
cara del
about
problema.
triple phase of the problem.
Y otro tema es la
And
inseguridad
something else
alimentaria,
is
¿no?
food
Es un
insecurity,
tema muy
which
importante
is
en
a
nuestros países.
very important
Hablar de
topic
más
for
del
our country.
50%,
Speaking of more than
hablar de
50%,
pobreza,
speaking about
son números realmente
poverty,
muy
these are
grandes,
very
son
high
números
numbers.
muy grandes. Pero señoras y señores, para esto
But
se
ladies and
necesita
gentlemen,
decisión
for that
política
we
en
need
todos los
political
niveles.
decision at
No
every
solamente
level.
estoy hablando a nivel
I'm
nacional,
not only
sino
talking
también
national level, I'm talking
necesitamos a
about
nivel regional.
priority of regional level and
¿Por
local
qué?
level.
Porque esos
Why?
gobiernos son
Because
los que están más
those
cerca de la
governments are
gente.
the ones closest to the people.
Creo que el tema de una
And the
atención
issue
integral
of a
es
comprehensive
importante. Yo
care is
quisiera
extremely important. You three
comenzar
have
en
mentioned,
alimentación,
start
¿no?
with
En el
pregnancy,
momento del parto, cuidado
at
con el
delivery,
lenguaje, no
careful with
olvidarnos de la
clamping the
lactancia
cord. Let's
materna,
not forget
mejorar la
about breastfeeding,
alimentación
improve complementary feeding,
complementaria, todo
everything.
eso se sabe.
All that is known.
El problema es
The
el
issue is
rigor con el que aplicamos
the
las
rigor to which we
normativas.
apply the standard
Está
or the
escrito,
regulations.
prácticamente todo está
Everything is
escrito.
written,
Estos nuevos
almost
concepts
everything.
que nos están
Those no
diciendo
cut-off
una
points
nueva
are
manera
just
de ver,
telling a new way
sabemos
to
que las
see things, but we
principales
know that
estrategias
the
son las mismas.
most important
Ahora,
strategies are the same.
no podemos dejar
Now,
de
we
lado el
cannot
enfoque del
leave
costo de
aside
vida.
the
Y
course life
efectivamente
approach.
no comienza en la
And it
gestación,
doesn't start
comienza
in
antes,
pregnancy, it starts
comienza en la
before pregnancy,
adolescencia, comienza en la
starts in
niñez. Todo es
adolescence,
un
in
curso,
childhood.
toda
It's
una
all
etapa.
life
Ahora,
course. Everything that
sobre
happens
eso lo que
now
pasa
has to do what's
después.
going to happen
Y
later.
ahí, como lo
And
dijo
there,
María,
as
eso fue,
Maria
es el tema de
mentioned,
desarrollo, es el tema
is
de
the issue
desarrollo
of
no solo
development, not
individual,
only from the
no solo
individual
familiar,
standpoint,
no solo
not only from the
comunitario,
family or
sino estamos
community,
hablando
but we're
prioritariamente de
talking about
desarrollo
priority of
nacional.
national
Queríamos,
development.
¿cómo se dice? Mejor gente, mejor país.
Better people, better
Con estos
country.
índices tan
And with
altos en
these
nuestro
high
país,
indexes in our
definitivamente
countries,
no vamos a
we
apostar
definitely are
a
not
un
going to
rendimiento escolar
bet for
óptimo, a
optimal school
una
performance,
performance laboral
a
mejor. Entonces,
working performance that's
necesitamos
better.
tomar
So
cada
I think that we
situación
need to
de
take
una
action,
manera
but
integral,
in a comprehensive
territorial y no tratando
territorial
igual a los que
manner
son
and not treating the
diferentes.
same those
Por
who are
ejemplo,
different. For
una
example,
cosa son nuestras poblaciones
one
de
thing
alta
is
vulnerabilidad.
our
Estoy
high
hablando de
vulnerability
nuestra
population.
famosa
I'm talking about
poblaciones indígenas, andinas,
indigenous
autóctonas,
Andean Amazonic
¿no?
populations.
Estoy hablando acerca de
I'm
poblaciones
talking about
afrodescendientes, pero también estoy
Afro-descendant
hablando
population, but I'm
acerca
also
de
talking
poblaciones
about
migrantes.
migrant
En este
populations.
momento,
At this
1.000
moment,
millones están moviéndose en todo el mundo.
1 billion are
8
moving
millones de
throughout the
personas
world,
se están moviendo y no están
eh,
teniendo
and
las
this, they're
mejores
not having the
opciones.
best options.
Y el otro tema que a nosotros nos
And the
interesa
other
mucho
topic of
en
interest
Horas
for
Cono
us
es el tema de las
in Orasconu
fronteras,
is the
porque las
borders,
fronteras
because
son
the
las más
borders
olvidadas
are
en
the
los países.
most forgotten areas in the countries.
Entonces, la
So
anemia es un problema de salud pública,
anemia is a
seguro.
public health, severe public health
Existen
issue.
estrategias, existen.
We have
Nelly ha sido muy
strategies.
clara que han habido
Nelly has
países que
been
han
very clear to
acelerado.
indicate the country
Quiero
has
decir que
been
sí
able to overcome
existe
this issue. So there
resistencia,
are ways of
pero,
overcoming this.
como dijo María
But
Elena,
as
no
Marilena
es
mentioned,
integral.
everything needs
Y
to be
cuando estoy
comprehensive.
hablando de integral,
And when I talk about
quiero
comprehensive,
recordar
I would like
mucho
to remind
esta
you
facilidad
this
de hacer la
easiness
diferencia.
of
Porque
making
el
the
problema es a
reference,
primer nivel, hacer el
because at the
diagnóstico,
first level,
empiezan a
the
llamar al
diagnosis
segundo
is
y
made,
tercer nivel
they
y se
need to the
pierde
second and
todo.
third level, and then we
Y
lose the
cuando el
patient.
tercer nivel ya
And when the third
necesita una
level
anemia
has a
diferente,
diagnosis of a
ya
different type of
para
anemia,
bajarlo al primer nivel
in
también se
order to
vuelve a
decrease
perder
it to the
la
first level,
patient. En ambos
you
sentidos
lose
se
the patient
pierde.
because
Así que
it's
yo
lost in
creo
both
que, y
senses.
ahora tenemos una cosa
So I
fabulosa,
think that we have something
lo
in
que
our
no
favor,
teníamos antes.
what we didn't have before.
Teníamos documentos de
We have
identidad, tenemos certificados de
identity
nacimiento
documents, we
vivos,
have birth
sabemos dónde
certificates,
están,
we know where they are,
¿o no, María Elena?
or not,
¿Cuánta
Marilena.
chamba nos ha costado eso?
How many
Sabemos
efforts
todo
we've
eso.
been that.
Entonces, yo creo
So
que
I think that
las cartas están en la mesa.
the cards
Lo
are on
que
the
nos
table.
falta es que
What we
cada
need
uno asuma
is
su
each one
responsabilidad.
assume his own
Como organismo
responsibility.
andino
As the Indian Health
y salud
Organization,
convenio Hipólito Unanue,
Hippolyte
nosotros
Unanue
tenemos muy
Agreement,
claro lo que
it is very clear for what we
Tenemos que
need to do.
contribuir a la salud y
We need to
bienestar
contribute to
como
health and
objetivos
well-being with two
fundamentales.
fundamental
El
pillars.
primero, lograr
The
que
first
cada
one is to
ciudadano
make
de
each
los 6
citizen
países,
of the 6
casi
countries,
170 millones,
almost 170
logre el
million,
mayor nivel
has the
de salud
gets the
posible.
greater level of
Y segundo,
possible of health. And number
disminuir
two,
las desigualdades
decrease the
y
inequalities
inequidades en
and
salud.
inequities in health.
Pero para que esto se logre, todos
But for
tenemos
this
que
to occur,
hacer bien
we
lo
all
que
need
nos toca
to
hacer.
make our
Así que a
part.
toda la gente que está
So to all the
conectada,
people
tenemos más de
who's
500
connected, we
personas
have more than
conectadas. Les
500 people
recuerdo,
connected.
por favor, regresen a
Please
sus sitios
go
y
back to
hagan lo
your
que les
working place and
corresponde,
do what you
¿no?
need to do.
Si uno está en primer nivel,
If you're at the first
hacer
level,
adecuadamente su
do an
prevención, el
adequate
diagnóstico precoz,
prevention,
el inicio
early
temprano.
diagnosis,
Si
and
uno está en
treatment.
el segundo nivel,
If
que
you're in
son
the
los
second
educadores.
level or
Si
third
uno
level,
está educando,
if
¿no?
you are educating
Educadores, todos tenemos que
educators,
ver en este asunto.
we all have to do in this
Absolutamente
issue.
todos tenemos que ver en este
Absolutely,
asunto.
all of us has to do
Pero
with
vuelvo a
work with
decir
this.
lo que dije
But once
siempre,
again, I will repeat what I
si
said
no
at the
hay
beginning.
decisión
If there's no
política, como
political
fue para la
decision,
desnutrición.
such as
¿Se acuerdan ustedes
malnutrition,
hace 10
you remember
años,
10 years
12
ago
años, cuando se
or
comenzó
12
la
years ago when
campaña de
they
nutrición
started
y
that
todo el mundo puso su
malnutrition
parte
campaign
y se
and
bajó la
everybody
desnutrición?
did their part and we were able to
Pero
decrease
yo
malnutrition?
creo que nos falta
So I
esto
do think that we still need that in our
decisión
countries.
política,
Political decision,
reconocer que la
recognize
multisectorialidad,
that
la
multisectoriality,
multidisciplinariedad, buenos
multidisciplinarity,
servicios,
good
buenas
services,
referencias y
good
contrarreferencias
referrals
y,
and
por
counter referrals,
supuesto,
and of course,
arroz fortificado.
fortified
¿No?
rice.
Ustedes son testigos.
You've
¿Cuándo
witnessed
lanzamos arroz fortificado
when
aquí
we
en
launched
Guayaquil? En
fortified rice
2018.
in 2018,
2018 porque yo estaba de viceministra.
because I was a
¿Cuánto
vice
pasó?
minister.
6 años.
6 years have
Así son
passed
los procesos.
because these are the process in our countries.
Nuevamente,
Once
muchísimas
again,
gracias.
thank you so
Agradezco
much.
también la
I
presencia de
thank the
Leo
presence of
Netherveen, que nos
Leo
ha acompañado de la
Netherveen
OPS, que
that's
siempre,
been joining us from
con la que siempre trabajamos.
Pajo.
Muchas gracias, María
Thank
Nieves,
you so much,
Nelly,
Maria
María Elena.
Nieves, Nelly,
Y
Maria
los
Elena.
invitamos a nuestro
And we invite
próximo
you
webinar.
to our next
El
webinar.
próximo webinar es este día
Is
jueves a las
this
11 de la
next
mañana.
Thursday at
Dentro
11
del
a.m.
ciclo de
within the
webinars que
cycle of
hacemos,
webinars
son
that
los
we are
webinars especiales
doing the
que
special
hacemos
webinar
con la Embajada
with the
Británica.
British
El
Embassy in
tema va a
Lima.
ser
The topic
visión
is going to be
británica sobre la atención primaria de
primary
salud.
healthcare
Así
according
que
to
seguramente va a ser
the
de
UK
interés
vision.
para
So it's
todos
going
y
to be of
todas.
interest for all of us.
Muchísimas gracias.
Thank you
Buenos
very
días,
much.
buenas
Good
tardes,
day,
buenas
good morning,
noches.
good evening.
Agradezco a Marisela
I
y
thank
a todo el equipo
Marisela
de la
and all the
Organización para la
group
Salud
of the Andean
que
Health
hacen posible
Organization
estos
that make
webinars
these
y,
webinars
por
possible,
supuesto, a
and
los
of course
participantes
to the
por
participants
sus
and
preguntas
for their
tan importantes.
questions that were so important.
Hasta luego. Nos vemos pronto.
Bye bye. See you soon.
Muchas gracias.
Bye.
Thank
Adiós.
you. Bye
Hasta
bye.
luego. Gracias.
Gracias.
Gracias.